jumping on our. We got a new stream, Jay.
Yeah, thanks for jumping on our stream again. Yeah, a little bit of a technical glitch, everybody. That Wi-Fi thing can be a squirrely character, but we're glad to have you back character. On. Yeah. Okay, so and if you're wondering if you're on the original stream, and yeah, I've gotten a couple messages already, but yeah, all we did, we just rebooted. Joser's the man. We're good
Reboot. To go. That's probably some good exercise. You jump on the first stream, and now you jump on another one. That's 2 jumps. Good for you. 6:45. Good morning. You're coming up.
Sorry, I'm just cracking myself up over here.
Yeah, I know. Care to share or
no.
Not airworthy?
He said 2 jumps. I was like, that's more than I've done in 2 weeks. Probably 2 months.
It's good. You get your heart rate up. Virtually, or
Okay, since we got a couple moments, guys, can I bring something up? I really took what the lieutenant governor said yesterday, like to heart. He actually asked us very earnestly, and he said, would you guys consider coming up with something creative to help the kids do Halloween safely? And I was just thinking about all the different parameters in the environment. I was thinking, are schools planning on doing that anyway? Because everybody's going to school like virtually. And I was thinking, yeah, maybe teachers can say, hey, students, dress up and do it, everything. I mean, that's not exactly easy for every school to do, because there may be some kids whose parents are going through some really hard financial times. I know for a fact that a lot of the Christian churches hold fall carnivals, or they do like things like that anyway, because they don't, endorse Halloween. So to actually tell a kid, it's like, oh yeah, everybody make sure you dress up. They don't want to have 30 kids in a class and one of them, didn't dress up in a costume because they, for whatever reason, they couldn't order it, they can't afford it, times are tough, and they don't want to make the kid feel bad. And I was wondering, the malls typically do something for Halloween, but obviously that is probably out of the question because of social gathering restrictions. And I was just thinking, if we are going to think about doing something and everything, there's a whole bunch of parameters we got to talk about. I mean, that is a big thing. And we were just talking during the break, Bree. It's like, you were actually telling me that Halloween this year, Halloween falls on a Saturday. Mm-hmm. And so that means that only 3 days later, according to the calendar at this point, then the general election happens. Mm-hmm. Those are 2 major events of social significance that are really, really scary in terms of this thing getting out of control.
If my grandma was alive, she would say, no All Souls Day, no Halloween.
Exactly. And I was like, the logistically, the easiest to implement and the most effective thing is probably just say, don't do anything across the board.
Just don't do anything.
I mean, it's not like Halloween is like a spiritual holiday, right? Because we have Our Lady of Cameron coming up. We got Thanksgiving.
Jay, it's for the kids, Jay.
No, but that's what I mean. But something should be done to help the children. So I was kind of racking my brain about that last night. But
okay.
Yeah, Bautista Christina writes in, stay home. Stay home!
There you go.
And buy your own candy and watch horror movies.
I like that.
Mm-hmm. Well, I don't watch horror movies.
Yeah, we should change it. Instead of Halloween, we should call it Halloween.
Wait, you don't watch scary
Trademark,
movies?
write that down.
Scary movies.
Jay, write that down. Halloween.
I don't watch scary movies.
Oh no! You watch kung fu movies, right?
Thanks.
I'm a
Thanks,
kung
Joe, sir.
Wait, Chris, are you a big scary movie guy?
I was trying to rock my Halloween, like Halloween, but Halloween, like we're gonna stay in. Yeah. And then Lou would like it because it's in. You know what I mean? They could put their little logo in Halloween. Let's turn Halloween into a Halloween.
I already committed that. That's in my mental Rolodex.
Thank you.
We're not going to do that. We'll figure something else out.
Back to the drawing board.
Yeah.
6:48. Anyway, thanks for jumping on our second stream. This one's a little higher, guys. You have to jump a little more. 6:49. There is an election, like Jason had mentioned. There's an election going on. Thank you for having that election. And we were able to go over to the Guam Election Commission this week and cast our ballots in the general. So basically, you don't have to be nice to us anymore. We're spent. We cast our ballots.
Right. In-office voting, it starts back up at 9 o'clock this morning with Manomko Hour. And then you should call, make an appointment. Same-day appointments are acceptable. 477-9791. That is the phone number. They are voting up until 6 p.m. It's 10 a.m. to 6 p.m. So, please make an appointment and vote. You can also register same day and vote same day. There's also tomorrow There's going to be voting at satellite locations. It's at FB Leongaro Middle School tomorrow in Jigo. That is from 9 a.m. to 4 p.m. Everyone, please bring your ID, your own blue and black pen, and masks are mandatory.
There you go. And here's the link on location of the Guam Election Commission. I remember about 12 temperature checks later, we're actually here on the third floor of the GCIC building to cast our general election ballot. I know you guys know I'm still a little bitter about my primary election ballot getting destroyed, but second time's a charm. And as Miss Maria Pangilinan of the GEC said, thousands have come out to cast their vote in the general election. We have Kyle here from the GEC. And when you come in to vote, when you get in that room there, they're going to explain who you can vote for and how you can vote for them. So take it away, Kyle.
Okay, so for the partisan side here, you're going to mark 15 senators, and you can cross over on that one. And then you're going to mark one non-voting delegate to the House of Representatives, one mayor, and then one vice mayor. Okay, and then on the nonpartisan side, you're going to mark no more than one public auditor, 2 for the Consolidated Commission on Utilities, 6 for the Guam Education Board, and then 1 for each judicial retention question. Then you're going to mark 1 for the straw poll.
Right, and that's for the presidential election. It doesn't mean that, you're voting for president. It's just a straw poll, just for everybody's information.
Yeah.
Is there anything else people need to know before they come out here to vote?
Just bring a mask, please, and a black or blue ink pen, and your ID.
Have you had people actually show up to vote without masks?
No.
How did the weekend voting go?
We had about 600 something voters. Yeah, it was very busy. Yeah.
And I know that you guys get a little more traffic here during Manomko Hour. Can you tell us a little bit more about Manomko Hour?
Yeah, so we have our Manomko Hour from 9 to 10. They're mostly appointments, so they'll sit down here and then they'll fill out their application and then they'll process them at the front. Yeah.
And tell us again exactly who is a Manomko?
Anyone over 65? Yeah.
Okay, well, thank you, Kyle. Now let's do the darn thing here. Cast our vote, and we'll go on in here at the third floor of the GCIC building.
No cameras allowed inside, so let's go. Got my pen, got my ID, got my mask. Just go this way. Okay. Okay.
Just like that, quick, easy, painless. I voted. Big thank you to the Guam Election Commission and their staff, working hard to make sure you cast that ballot and that ballot counts for the general election. Bree, the takeaways?
It was quick. It was easy. Just remember, if you're going to vote, to bring a black or blue pen. Masks are mandatory. And bring an ID. Also, you should schedule an appointment. Call 477-9791. And, of course, for more information, go to gec.guam.gov.
Hey, my name is Chris. For Sabrina again and the staff here at the GEC from the GCIC building. This is the link. All right, 6:54. The show again. It's the link. Carrier 647 Cool, Calvo Enterprises, and IT&E. Our next segment here brought to you by the Thrive Coalition, where it takes a village to raise healthy and drug-free youth. Come on and thrive with us. We're bringing you this sneak peek of the One Micronesia podcast with our very own Victorious Falan. For this week's episode of the One Micronesia podcast, KUAM's Vic Falan has a full Zoom room talking to the hardworking, compassionate, and proud folks that make up the Micronesia Resource Center team. So here you go, a little sneak peek of the brand new episode of the One Micronesia podcast.
And guys, thank you so much for jumping on here. We'll talk about, we'll go ahead and break it down, the different programs you guys have, just pretty much a summary of what it is. So people out there who's watching the podcast and they would know, first things first, what programs you guys have. We'll start with the Welcome to Guam Orientation. This was something that was brought up years ago, I think 2 years ago. I guess I'm going to go to Jen to this one. So tell us more about this Welcome to Guam Orientation.
Yes, thank you. Yes, the Welcome to Guam Orientation is an informational workshop that provides technical support and migration training to the Freely Associated States migrants, or the FAS migrants, as they transition to living here on Guam. This workshop establishes an ideal basis quality platform as residents of Guam by exploring the laws, how to acquire important documents, and highlight the similarities and differences of living in the FAS countries versus on living here abroad or living here on Guam. It also provides awareness raising on the risk of human trafficking, as well as referral to service providers on Guam on legal and medical and other social welfare matters.
Now, my next question, and this is going to be open to anybody if you wanted to jump in and answer. Now, with a program like this, would you think this would be a program where people would look at like, well, like I'm not dumb, like I know what to do, or would you think there would be some challenges down the line with the program?
In the beginning, because it's a long workshop, and then in the beginning, some of the basic information people already know, but then it kind of like wears them out in the beginning, but then as it moves on in the middle, there are also like informations that other people do not know about, maybe the law or other kinds of variations of differences with the culture always different here on Guam and always different back home in the FAS countries. So definitely there's a lot of hardship, a lot of difficulties when people think that they might know some information, but then they kind of picked up later on within the workshop.
Honestly, it's such a great program, and I think when you have people prepared when they move from the islands here to Guam, you let them know what to expect. I think it really helps them, especially down the line as they continue their living here in Guam.
All right, there you go. Brought to you by the Thrive Coalition, where it takes a village to raise healthy and drug-free youth. That was the sneak peek.
Right, you can catch the One Micronesia podcast. It is going to be streaming on our Facebook page. Also, broadcasting tonight on KUAM TV 8 at 6:30 p.m.
Yep, 10 a.m. tomorrow. It's going to be live on Facebook. So if you guys want to comment it, shout out your friends, tell people about the great work that the Micronesia Resource Center does, or watch your friends talk about their very cool commitment to our community. You can do that if you want it. Check it out right now. Go check it out on YouTube.
There you go. So it's early on YouTube, Jay.
Yep.
YouTube gets the worm. It's 6:58 Friday. Whoa, badness. We'll take a quick break, and we're coming back with an update of last night's Physicians Advisory Group meeting with Dr. Ho Wen next on The Link. It's The Breeze, 93.9.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
Pepsi Guam Bottling, a local company. We produce your favorite products right here on island, like Pepsi, Mountain Dew, Hanum, Chamorro Punch, Tropical Ice, and more. We've invested millions into local production and will continue to upgrade our facilities and provide local jobs so you can truly buy local. Our long history of producing the freshest and best products will continue. This is our vision. Pepsi Guam Bottling.
Your generosity can change lives. Disasters won't stop during this global pandemic, so neither will we. The Guam chapter of the American Red Cross is calling on the continued support of the community to assist with their mission of providing disaster relief and recovery efforts, military family support, and life-saving training and certifications. In times of emergency, our support will not waver, and we pray that your support of our efforts will continue as well. We invite you to join us in commemorating our 20th annual signature fundraiser virtually this year by by supporting the Red Ball in a Box. We will be delivering special red boxes, which include a 4-course dinner from Micronesian Chefs Association and wine to our patrons and sponsors. As a sponsor, your company and message will also be featured in a special television tribute to the Guam chapter of the American Red Cross. For sponsorship opportunities and more information, please call 688-0280 or visit our Instagram or Facebook page. Let's support our community. Though we're apart, we're still together in generosity and support.
Celebrate National Pizza Month with the Pepsi Pizza Report. Pepsi helps celebrate this tasty month with an easy way for you to win Pepsi and pizza. Post a photo of yourself enjoying your favorite Pepsi beverage to KOM News or Uno Instagram or Facebook pages to enter to win Pepsi and pizza from one of our pizza sponsors. Catch the Pepsi Pizza Report every Thursday on KOM News' The Link Morning Show and on the social media pages of KOM News for reports, tastings, and everything pizza and Pepsi.
Thrive, a coalition for a drug-free Dedido, is an active partnership of community members and leaders committed to a vibrant, resilient, and empowered Dedido. It takes a village to raise healthy and drug-free youth. Thrive with us. Find us online or email thrive@westcare.com.
You're watching The Link with Chris and Sabrina on TV 11, but don't leave yet because we're coming up next on CBS This Morning.
We got your 6.
At 6 a.m. with The Link on Breeze 93.9 FM. Bree and I connect you with all the latest news and information you need to know to start your day.
Then check back with Guam's news leader at 6 p.m. for the day's top headlines with KUAM News Primetime.
From 6 a.m. to 6 p.m. and everything else in between with KUAM Digital, we got your 6. In the Zoom room. Hey, we got some comments here. Thank you guys so much for jumping on our KUM News Facebook Live feed. Robert writes, good morning. Why would public health withhold info on that local business that had employees that tested positive? Unlike Payless, when they put out to the public about their case, why is public health withholding info? I believe the people need to know unless they're not sure if that local business had employees that tested for COVID. There you go. Rosemary writes, if public health finds positive employees at a business, what's the criteria for closing down that business to allow sanitation procedures and having employees tested? So we reported on this yesterday, right, Bree?
Mm-hmm. We did. And we also asked public health for a response and, more information about the cases. But again, they do not identify businesses where there are positive cases, but leave it up to the business themselves. So that's why when you saw Payless come forward, they did that on their own.
Right,
Cowles Insurance did that on their own, and other businesses did that on their own.
Yeah.
Right.
I mean, but, and I know you guys know, public health has been inconsistent about this, because way back in the first lockdown, when we had people who went to Iglesia Ni Cristo, there was a whole cluster. They didn't hesitate to name Iglesia Ni Cristo. When the airmen, that whole thing with the airmen, and where they went around and broke their, disobeyed their orders, public health released a list of, I think, 30 establishments that 31 that these airmen had gone to.
I have a question for you guys. I really don't know.
It's not about Halloween, is it, Jay?
No. no, serious news, right? But you were saying that, public health does not disclose, Bree, you were just saying that they don't disclose the name of the business. Does HIPAA apply at the organizational level as well? I don't know.
I don't know. I feel like HIPAA, they're kind of using HIPAA. It doesn't. Yeah, we have Dr. Hoa.
Yeah,
He's gonna
Doc's in
come.
there, but he's shaking his head, so apparently.
And Doc's
so
got
they
his
just
own.
do it as a means of like an ethical consideration, perhaps?
I don't know. I don't understand. Yeah, so they just don't want to hurt anyone's feelings. Maybe they get a discount at the business.
Yeah. And, it's just also just kind of contradictory is the fact that the Division of Environmental Health, the inspectors, they go out and they inspect all these facilities for COVID-19 and also for sanitation inspections. And yet they release the names of these businesses. They release the violations that they found at their establishments. So I just don't understand. I mean, if we're all talking about, fighting COVID, arming yourself with knowledge, it's like you would think that would be something they would do and let us know.
Yeah, and I think in this specific case, what also might be hindering the business coming out publicly is that it's a national chain, and they've got a whole corporate structure. You know how it is. They can't even say hi to us without running it through 5 different corporate offices in the States. So that's part of it. But I think at this point, everybody knows what retail business it is. I mean, you're seeing it in the comments. People were messaging me last night. Yeah, so and let's bring on Dr. Hoa from the Physicians Advisory Group. We'll just start with this, Dr. Wen. I know that you don't agree with public health not naming the business. Good morning.
Hi, good morning, guys. I think there's certain things you have to look at, so if a business just have 1 or 2 person positive and you do the tracing and it's come back to the family, then it's not a really huge problem. But when a business have a lot of positive employee and there's a high possibility that the spread is within the workplace, especially if you are a place where you provide service and retail for the customer, definitely they should be disclosed to the public just because the public frequent those places. So I think at a certain point, it's not a HIPAA. HIPAA is a personal information.
Okay.
So, for the public, they should be able to name the business to make sure that, when people go there, they have to take caution when they go there. And that's my opinion as a physician.
Yeah.
But that is nothing wrong with disclosing business. But if a business, I would step up because you are doing your business in the community, and it's helpful for the community to know.
Right. And how many doc positives at a specific business would be of concern? 1 or 5?
It's
or
not.
6?
It's not the number, Sabrina. It's basically, contact tracing and within the business or by public health would know that, hey, the positive case come from the home or it come from the place of employment. And the biggest part on the business side is that I would highly encourage all the business to take a look at the way the employer, kind of interact within each other. Especially during lunchtime. That's where I think that when you eat lunch at your workplace, you drop your mask, and that's where the possibility of the spread the virus occurs. So I would encourage all the employer to kind of take a look at that setting and basically take precaution and take some measurements, something to try to prevent that.
Yeah, I want to
There's a breakdown in the.
I want to read from Nestor Lecanto's story here. Public health spokesperson Janela Carrera said if public health believes there's the threat of the potential spread of COVID-19, it will step in and investigate. If there are positive cases, the establishment is required to cease operations, wait for 24 hours, and then thoroughly disinfect the premises before it reopens. Many local companies and government agencies who've had positive cases within their workforce have voluntarily announced their closings and reopenings for the safety of their customers and the employees. However, Carrera says a business doesn't need public health clearance to reopen once it's completed disinfection. And I'm just going to go ahead and say it, Doc, because it was confirmed through employees of this business that the 41-year-old fatality yesterday morning was actually an employee of this business. So what I think is key when you talk about contact tracing, one other reason that the public should know which establishments are having a few positive employees is so that people out here who went there or who know people who work there can understand and know, like, oh my, okay, so I had a contact with somebody who worked at that place. Let me go call. Let me monitor myself, or else we're just flying blind.
Yeah, it's true, and that's what it's truly, like I say, it's just not the number of positive in the workplace. It's how you do the contact tracing, identify, hey, originate in the workplace, or you take it from home, and it's important to know the difference, and you have to know the difference. So it takes several days already, so public health should know, and I think that sooner or later they have to come out and name the business somehow. It's a protection of the community.
Is this something that the Physicians Advisory Group has discussed and if not, can discuss and make recommendations to the governor? Because at the end of the day, she has the final say.
PAC is an advisory group. We don't make policy for public health or have any enforcement of public health. We just look at the whole situation, discuss within each other, and make recommendation. And it's really up to public health and other government agency to follow or not. We just, as a physician group, we look at it and we say, hey, this is it's not good. You got to change something. But it's really, we have no enforcement over the agency. So
right, no, I understand that, but is this a recommendation though that the Physicians Advisory Group would give to the governor, who is the public health authority and has the final say?
We would advise them to, on this case, especially that the positive come from the workplace. We would recommend that, hey, you need to identify it and you need to name it. The public have to know. I wouldn't feel comfortable walking in a place that I don't know nothing about, and that's it's kind of stem out the rumors and people on. That's the biggest part. Is we live in the age where this thing can spread in the Wi-Fi and that look bad for your business. So I think for the safety of everybody, you should come up and say something.
Well, Doc, do you know what business it was?
We identify some positives in the business, but now public health have the big number, right? I can see in my clinic 1 or 2, but other clinic also see 1 or 2 also. So when you add up a whole bunch, when we talk to your patient, it's in kind of possibly discern business. But like I say, in public health have a big number because they tally everybody and they know where they are, so they should know exactly where. It's on the net. You say, I not say that's the right place, but just like what I read on the internet, I know the 41-year-old person that passed away from Kmart, but that's a place where I'm not sure. I say they have to step up, or public health to have to name them. But
so wait, Doc, let's go back here. Did you confirm that the 41-year-old fatality was a Kmart employee?
Yeah, that's what I read on the net yesterday. But I said, but that's have to be clarified by the agency that have to total number. When you do contact tracing, it's just like when we do in the clinic. We ask the first question: where do you work? When the last time you worked? Because that kind of help us narrow down to, what else we have to test in that business, and so we advise the person that's positive, hey, go back 4 or 5 days, tell your employer, they need to trace back 4 or 5 days. So we ask this question in the clinic in order to help the employee that turn positive, to advise the employer of how to do the contact tracing in their own workplace.
Yeah, I wonder if this business shut down for 24 hours, like Janella said they were supposed to, and disinfect the location. Do you know if that happened, Doc?
It's not a requirement, guys, for a business to shut down 24 hours. They do that precautionary to make sure that everything get desanitized and get ready for the customer to come back in. But I don't think it's a public health law that you have to shut down to do that. But like I said, depend on what type of retail store, what type of service store that you have. That's you make the determination by the management, and that's why most of the workplace kind of decide to shut down to desanitizing because it make the customer feel more comfortable.
So was it Kmart?
That's what I read in the newspaper. Like I said, either Kmart or any other business that on the list there that step up and do and announce themselves, or public health have to do it. They name on the business that the active duty frequent in the past. So I know that they get some heat on name of the business, but at some point, the church did it, some church did it, some other place did it. So I think you live in a community, you provide a service community. It's time to let the community know because you.
Yeah, I mean, it is really just disingenuous when you see PSAs like "I protect you, you protect me, I respect you, you respect me."
But we protect the business when it got a lot of positive.
Yeah. That's a lot of change, and like I said, we pushing hard on the pack and advise to be release more number, so that way the business know, and also for everyone else to make decision. It's important, and as we move forward, like I say, we're not going backward. I know there's positive case going up, but we really have to move forward and really ask everyone in the community to really, just like you say, respect each other, and protect each other, because if we let our guard down, this number is going to go up, and it's going to hurt everybody, hurt the economy, hurt everyone. So again, I talked with you last night, the biggest number one positive right now is the family gathering. And this virus here really take advantage of our culture. Our culture is family gathering, and I tell you, so many cases that we see the family say, oh boy, we make a big mistake, and in order for us to kind of make this positive rate go down, is for all the family to not visit each other for about 2 weeks. You don't have to lock down. You just stay home and keep within your household for 2 weeks. And I tell you, this number will go down because that's all we hear about is we visit each other, we have a gathering, and now every family going to turn positive. And that's the number one positivity rate is in the family at this point.
Right. Doc, I want to just go back again because I know that we were the only media to report it, but the possible spread among employees at a well-known business, can you confirm that business is Kmart? Yes or no?
Just like I say, we read about it, and there's high possibility, but the public health have the number. They can tell you yes or no. But to me, the only thing I can tell you is that what I see, but I don't have the final number. There's a lot of business that have positive in the business. Kmart not the only one. So there's multiple business, and that's why I've asked the employer to really look at how the employee interact each other during the work days.
Right.
It's not the only one, guys. It's not, and again, I'll fix it. Say number two positivity right now after the family gathering is a business. yeah, we come to the cycle that we see, you know, within our practice, hey, there's certain group and certain things that go up, and so family gathering number one, business is number two. So the business really need to take a look within the workplace.
We had a comment here, Doc, from Guam Seller. Cases are everywhere. Rather than name a business, just act and assume that it is everywhere and protect yourself as if you could get it.
100%, and that person is correct. You have to act like everyone else around you is positive, and at this point, that's the only way we protect this thing, because the only way we can give it to each other when that mask is off. When your mask come off, and within 5, 10, 15 minutes, you might have a pick up somebody that sit next to you. So, you know, if you pretend like the person that sit next to you is positive, then you will always have that mask, or you social distance yourself. If you're gonna take your mask off, and that person is correct, you know, pretend like the person next to you is positive. But unfortunately, sometimes during the normal daily activity, we tend to forget that, and it only takes a few minutes for us to pick up the virus. I can't see it, and some people have very mild symptom, and that's a problem. And the business place, I tell you, the reason it come up in the business because people are going to work when they sick, and frustrated to see that, but people still go to work because they sick, you know. So the employer needs to kind of be relaxed on the sick you know, policy in the workplace. So because people, you know, they go to work because they need money. That's the thing, and that's, if you're the only breadwinner of the family, and they have to go to work, they will go to work if they feel just like a little bit of congestion. But but they have to go to work. So the business have to, I don't know, it's hard for me to say, but they have to kind of relax the sick policy somehow to allow people to stay home.
Right. Doc, 58, the latest numbers, 58 COVID-related deaths, 66 positive last night. 2,934 people have been infected with COVID, 810 active, 2,000 recovered, 47 COVID patients hospitalized at GMH, 13 receiving ICU level of care there, 3 people hospitalized at Naval Hospital, and 2 in ICU last night. What did you guys discuss last night during your PAG meeting?
You know, again, you know, we discussed of how to move forward in this. It's impossible to go back on lockdown. It's really impossible. I mean, that's not a good option at this point. And we really plead with the community and the family to really respect each other. And just 2 weeks, that's all we need. Is you can go to work, you can go home, but don't visit each other for 2 weeks.
So go ahead.
And the possibility that we will see the number go down. You know, don't visit your relative. Don't, just 2 weeks. That's all we need. And because, you know, people are stay away for so long now that they miss each other, and they want to visit each other. And the problem is right now it's not the right time. So we're just going to ask everybody to kind of hunker down for 2 weeks, go to work, go home, and stay within your household. And, you know, the number of hospitalization will go up.
Yes.
Going to lag behind about 2 weeks, but it will continue to go up. And
so you saying that we're going to see a complete lockdown for 2 weeks? Is that kind of what you guys are leaning on?
No, not the complete lockdown. We're not going backwards.
Okay.
We're not.
So what are you saying?
Okay. I mean, the family unit have to stay within the family for the next 2 weeks. That's what I mean. You know, you can go to work, you go home, but uh, don't visit your mother. Don't visit your sister. Don't visit your brother. Just stay within your house for 2 weeks. That's what I mean. I mean, respect each other because you don't want to, inform your family that, hey, I'm sorry, but I'm testing positive. Now the other family in the other household, they're all going to be test positive. So stay in your household for 2 weeks. That's what I mean, Sabrina.
Is that like gonna be through an executive order, or it's just a recommendation by the PAG to the governor, or it's just a recommendation you're making to the community on the show?
It cannot be an order. It's through you guys. It's a very good public service and through the newspaper, through the media, through the Facebook. Whatever we need to do to try to ask people, stay with your household for 2 weeks and try not to visit each other. But we have Thanksgiving coming up. And you have Halloween, all kind of stuff. Every time that we think we get over the there's a holiday coming up, and we're back to square one again.
So what was the primary discussion during the PAG meeting last night?
That's one that we're not going backward, and we had to kind of do a lot more target testing on certain group, and then they're building up a rapid response team that will try to go out there and kind of isolate the positive really, really quick in order for them to not spread out. Because you understand, if you have one positive in the family, the rest of the family has to be isolated contact right away so they can stay home. But if you have one positive family and the other family member is still going to work, there's potential they're going to spread out the virus to the workplace because you have a positive in the family. So, but that process had to be very quick. That's the only way that we can make sure that the virus contained within that family only and not get spread to other people around you or the other business. The rapid response team is we got to put that thing together really quick.
Yeah, Doc, we had public health. I just got to say, though, we really tried to get public health on this morning because I believe that with the high number of positives, the high number of deaths, the high testing positivity rate, we're in the middle of a public health emergency. I feel like public health needs to have more of a and they do. They come on every Friday, but for some reason this week, we got Tuesday, Janella and Mrs. Tyron to talk about the quarantine, but we haven't had anybody from public health come out and say, hey, this is where these positives are coming from. This is who we did the target testing on. And I feel like it just look at us. Look at what we're talking about. People are freaking out now because there's no word from the public health authority. And so we had them on. We talk about contact tracing. I got a friend who had messaged me regarding your contact tracing discussion this morning. They had an employee that tested positive, and he was contacted by public health 8 days later. And this is not an isolated statement. I mean, I'm hearing that although in the oversight they said that, they actually do contact tracing and they do it well, which I'm pretty sure may be the case sometimes. The ones I hear about are people who test positive and they don't hear from public health until like a week later or more.
Yeah, that's something we agree. I mean, there's a lot of room for improvement, and in order for us to contain this thing, and like I said, we're not moving backward, we're moving forward. But in order for us to move forward, and we're gonna cut down this thing, the number one thing that we have to have is the isolation and the contact tracing as the number one key. I put all my money, all my basket on that, on those two teams. Right now, I tell you, there's no limit on the amount of fun and the amount of people that need to pull into those two, because that's the key for us to go forward successfully is to be able to contain this. You really can't get rid of it. You cannot, but you can contain it effectively if you do the isolation and the contact tracing to surveillance team do the right thing. So we continue to advise them to really put a huge amount of effort in this one. We just look at Hawaii. They completely revamped the public health. They replaced everyone in the public health in Hawaii just to um, because and they have the same thing like Guam. They have problem with the transparency to report the number, um, and the contact tracing. And Hawaii is a much bigger population than we are. So if we can, we are 160,000 people. So if we fix ourselves when we do the right things, I think that we be okay. But it's not just a public health problem. It's the whole island. We really need, as community, everyone to follow the rule, and we will be okay if we do that.
Doc, earlier in the week, I got a question from someone who messaged me on Facebook, and it was about the medicine that doctors are using to prescribe to COVID-19 patients. Can you tell us what exactly are patients here in Guam being prescribed for COVID?
The medication to treat COVID is strictly on through the IV at this point, and that's only can be admitted in the hospital. It cannot be used in any type of acute care clinic like AMC, FHP, or a big clinic. It had to be in the hospital only. The cost that people kind of take and I know that there's a push on let people know of what vitamins, what supplement that people can take. And with President Trump on all of them, and I think as soon as that thing people know about it, probably you don't have anything on the shelf at any store in Guam if people at home buying this stuff. But vitamin C, vitamin D, melatonin, Tacamid, aspirin, and zinc, and those are stuff that people can take to boost their immune system. Like I say, and that's all you can do at this point. There's no outpatient treatment for COVID-19 that really, really effective. You have the influenza. I can give you Tamiflu, and you get better in a few days. But the problem with COVID-19 is there's no effective antiviral medication it can give to you as an outpatient.
But do you know
and there's no antibiotic need. So it's a virus. Antibiotic doesn't work. A lot of patients request, Zitromax or anything for antibiotic for when they COVID-19, and it's wasteful. It's not going to help you.
So basically, you're saying, Doc, that the medicines that they use to treat COVID-19 that we might hear about nationally are only given in the hospital setting once you've been hospitalized.
Yeah, only in the hospital. That is not given anywhere else. I can give IV Rosef in the clinic for antibiotic wise. I cannot give that in on the outpatient setting, and it's not approved. It had to be monitored. So.
So what was the medicine? I'm sorry.
So which medicines do they use in the hospital setting, Doc?
I think the remdesivir or something like that. That's in the
Remdesivir.
that only used in the
Remdesivir.
Yeah.
Remdesivir.
That's the only one that can use in the hospital. That's the only one they can give. And I know President have a new, a treatment that is not widely used. Only a few people have it because it's still under study.
It was like a stem cell treatment or something I read.
That's an experimental drug, and you can't have everywhere.
So that's what they're using at GMH, remdesivir.
Yeah.
And do you know? Do you guys have discussions on whether or not they're like stockpiling up on that?
I think that they're not short of that, you know.
Okay.
So everyone come in there have multiple doses. You know, you have to treat them at the beginning, and then after a certain point, when the virus not there no more, you have to worry about the anti-inflammatory effect of the virus. So you know, it's a different treatment after about 5-7 days or so. It's a totally different treatment because you deal with the inflammation caused by the virus. So.
You know, we had a interviewed a woman last night. Adriana Cotero did a story about her mother and father had tested positive. I think it was back in August, or yeah, I believe it was in August, and they had recovered, but they still test positive for.
Yeah. I know. I'm about to find out who's the person that I can reach out and talk to them. You know, it's a very simple decision. You know, I mean, once you test positive for the PCR positive for the COVID-19, you know, you follow the symptom. After about 10 days or 2 weeks or so, your symptoms should go away completely, and you don't retest them. You know, you don't retest them till 3 months from now. You know, but if you retest the person and they become positive, doesn't mean they're infectious to anyone. You know, you're still gonna pick up the viral particle up to 3 months. So no one should be testing a person that is positive until at least 3 months later, or unless they become symptomatic again, then you retest them. But to test the person again after 10 days to 2 weeks and turn positive, the only thing you do is create a lot of anxiety on the patient, especially if you don't give them the right answer. You know, so I'm not quite sure, you know, why anyone would want to test them again in within 10 days to 2 weeks and it turn positive and don't give them the right answer. You know, uh, I mean, that's not the guideline because we know that after about 10 days to 2 weeks, you no longer infection anyone. You know, so don't test them again because more likely quite a few people will remain positive for up to 3 months, Sabrina. So they're not infectious. So
Right. Yeah, it was
I
2 months. It was 2 months after, and they were tested, and they were positive.
again, unless they have become symptomatic again, Sabrina.
Yeah.
You know, say that you come in and you complain of the same symptom that you have the first time you're positive. Yeah, there's a possibility that you get reinfected again. That's not the exception because people know that you can get reinfected again. You know, after the first one, so doesn't mean you're immune.
Right.
So,
Yeah, they went and got tested because they wanted to, go back to work. And so when it popped positive after 2 months, I guess the work required that to be a negative test result.
And
so now
that's the place where you have to convince the workplace somehow, but if they totally asymptomatic, have no symptom, I don't care. They 2 months that they test positive, they are not infectious. They don't have no more symptom. So but again, that's why CDC don't recommend it that you retest anyone until 3 months afterward.
Right, but I mean, imagine being these people trying to get back to work and you have to take a COVID test. It's positive. I mean, what are you going to tell your boss? Like, oh no, it's not really. It's okay. I mean, we're holding up these test results as the holy word because we test people and we have so much faith in the positive and so I mean, it's got to be tough for these.
That's the anxiety. Yeah, that's the anxiety part of the employer that there's certain employer that are very strict on that, and even if we quote anything on the guideline, but again, that's the responsibility and decision of the management of the employer, the workplace. But sometimes it's unreasonable for employees to expect that. But every one workplace have to make their own decision. But as a physician, we just want to explain to the patient, and I have plenty of patients that keep turning positive, and I just reassure them, hey, you guys, you're not infecting anyone, so that's something that. But again, it's something that it had to be explained to the patient in a way that they understand, so that way they don't feel so anxious. I feel sorry for the for the two elderly couple that have positive and have different messages from everyone, and that's I don't know. I feel like there should be message out, and everyone should be on the same page on that one.
Doc, I wanted to follow up back on this situation at this big retail store. And really, it's just a general question for companies and businesses. If there is a positive case in their company, does
any
the management have to inform employees that there is a positive case?
I think if we be very nice for them, for management to inform the employee, because that's how the contact tracing within the company occur, right? I mean, there's lots of company that they're on tracing now, and the advantage part about it is that you kind of isolate those people that positive and people around the close contact, so that way in the workplace, your employee know that, hey, the upper management are taking care of them, are looking after for them, and it helped public health contact tracing. So yeah, it's nice that management will inform down the line that they are doing their part to try to do the contact tracing and get the people in a close contact to be tested.
So it's nice, but it's not necessary. It's not required.
I don't think it's not required. Yeah, I mean, but that should be a workplace policy.
Okay.
Because this is in fact, guys. I mean, it's you gotta look after it for your employee.
Thank you, Doc.
Any final words
You're
before we
welcome,
head
Jack.
into the weekend?
What's your advice for people this
Yeah.
weekend?
Our advice, I tell you from the pack, is that we talked about a lot last night, and we really plead to people and everyone in Guam to again stay within the family unit for the next 2 weeks, and let's work together and moving forward and cut down the positivity rate. It's really helpful. If not, we're gonna go forward, but it's not nice to go forward. The hospital is full. And for another one for the people is that if you are identified positive for the COVID-19, please don't wait at home so long. If you have any difficulty breathing, you got to go to emergency room right away and don't stay at home so long. And if you do, the chance that you survive in the hospital with supplemental oxygen and the treatment is good. So don't wait too long at home.
All right.
Thank you,
Okay,
Doc.
guys.
Okay.
All right,
Do you
thank
want to
you.
do you want to confirm if it's Kmart before we let you go? I just figured I'd ask you one more time.
No, I cannot do that.
All right. Thanks, Doc.
Thanks, Doc.
Okay, guys.
Okay. See ya.
There you go.
7:43. So move it along, and then we'll unpack this whole discussion on Bree. Any takeaways from that? This is a lot. Wow.
Just basically stay home.
Yeah. We'll bring on Dr. Peter Lombard, and we've had this transparency conversation. I mean, God, since the first lockdown with Dr. Lombard, and I mean, we sound like a broken record. If you guys don't know what a broken record is, just Google it. A skipping CD would be probably the modern equivalent.
It's an MP3 with problems.
Right. So, Doc, good morning, first of all.
Unmute.
Unmute. Don't you hate it when that happens?
Good morning, everyone.
Good morning.
Sorry about that.
No worries. Yeah, Doc, so here we are again talking about public health transparency. It never gets old.
Never gets old, and we never get tired about talking about it.
So what's your take on this latest? We reported on a large retail outlet that had, some spread among the employees. We confirmed with those employees, and Dr. Ho had also confirmed that one of the fatalities yesterday, the 41-year-old, was an employee of this large retail store. I mean, there's only how many large retail stores on island? So just, I mean, that being said,
Yeah.
Doc,
It's in Upper Dumont.
yeah, it's an Upper Tumon. It rhymes with J Mart.
It's across the street from JFK.
Well, it's the first time I'm hearing this, so just off the top of my head, I think that every business here in Guam has been affected, and it shouldn't come as any surprise that a large retail store has a few cases. So I think I just caught the last of that discussion with Dr. Nguyen, and what do owners and supervisors do in the workplace? And unfortunately, I mean, they're not necessarily trained or equipped to help do an internal contact tracing. If the best they can do is understand what a close contact is, find out which of their employees are close contacts, and instruct them to isolate until they hear further from public health. Because in the absence of doing anything, in the absence of doing that on their own, in the absence of telling all the employees about what's happening, in the perfect world, public health would be initiating that conversation with all the employees based on their contact tracing efforts, and we just know that that's not happening in a timely fashion. So I think for the business leaders out there, unfortunately, some of the responsibility does fall on you to try to do some of that initial contact tracing to keep your employees and your customers safe. Even the White House event, they apparently didn't do a very good job with tracing, and they're crowdsourcing people to try to identify everyone that was at the Rose Garden event, and it's sort of a community effort to try to identify all the potential positives, because these a single positive can easily turn into a much larger spreading event, and it clearly identifies one of the weaknesses that we've talked about in what's happening in Guam right now is our contact tracing.
Right. Yeah, I mean, we hear from public health that, it's all great, but then I hear from people, and I don't know how anecdotal it is or not, but they're saying that, hey, we had somebody test positive. They didn't hear from public health for over a week. So a little bit of mixed messaging. I mean, what else is public health going to say? It's not like they're going to come out and be like, yeah, we're drowning with the contact tracing. I mean, they're just not going to say that. What they are saying is, yeah, we got it. Don't worry.
I think it'd be nice if they acknowledge where they're, they could use a little work, where they could still, they're a little bit behind. It'd be better. I think it'd be better to hear that, show a little humility than just say everything's great, because we know it's not. And when we know it's not because of what we're hearing anecdotally, granted, but when we know it's not, then for them to say everything's rosy just smacks of, them not being as upfront. If they truly believe everything's great, then that says, well, maybe, they're not analyzing their data correctly, because it just doesn't seem that way from our perspective. And they haven't shown us enough data and analysis to show that their contact tracing is sufficient. And we get almost no data from public health outside of the reports. I don't know if Dr. Nguyen mentioned it, but he had mentioned to me that they are considering making some pretty big changes to the JIC report, which will make it a little bit more transparent. And he actually asked for some input from the providers about what kind of information they like to see. So, I passed along my requests, kind of the same stuff I recommended back in March for the type of data we'd like to see on the JIC report, and we'll see, maybe that'll help a little bit. But one useful metric on the JIC report every day would be to say, hey, how many positives have not yet been contacted by public health? I mean, you're having 60 a day. How many of that 60 have not yet been contacted? Or within the past week of the 400 or so that we've had in the past week, how many of those have not yet been contacted by public health? That would kind of give us a useful metric. Now, give them a day or two, sure, so we can tolerate maybe 100 or so. But if that number is much higher than that, then that we're not getting to the contact tracing quick enough. And every contact, how many people are they going to, how many names are they going to give to public health that are going to require additional calling? It becomes exponential at some point. And you realize it's unfathomable how big of a job that is. And again, we all acknowledge how difficult it is.
Doc, we got some,
and I'm sure they're doing their absolute best over there with the personnel that they have, but it's just not enough.
We got some charts from you. You care to kind of go into these a little bit? There's one here that's, I think, case age by week.
Yeah, so I've been talking a little bit about the ages, and I think it'd be kind of useful to see that in the graph form. I'm not seeing what you're looking.
It's the bar chart, Jay. That one, yeah. Okay, well,
Yeah,
we
just
got
let
it
me know
up.
which one you want me to bring up, Pete.
Yeah, we've got it up, Doc.
Yeah, the age with the colors would be fine. So I've been trying to track the percentage of all our positives that are over a certain age, within all the age groups. Do you have that one up already? I'm not seeing it.
Yeah, we do. There's a little bit of a delay on the live stream, Doc, but we've got it up.
Oh, okay, gotcha. So, that kind of shows the breakdown of per age group, where these cases are coming from. And well, number one, it shows that cases are increasing week over week since really, we had over September and certainly the first week of October, our cases are back up again. We're pretty much, had the second biggest week compared to our peak at the end of August. But if you look at the color coding there, the light blue is where the 50-year-old age group is, and then the yellow gets down to the 60-year-old. So you can see the percentage of all of ours over 60, and I'm calculating that out to be about 14 to 15%, and it has been increasing a little bit over the past few weeks. So not only are our total numbers up, but the total percentage of those over 60 is increasing a little bit as well. That seems to be fairly standard percentage, though. If I looked at a little bit of data from the U.S. and percentage of cases over 60, it's around 15% or so. So from that perspective, it's okay. What we want to see is more of that percentage in the lower age groups, and what has been happening typically in these second and third waves in other cities and states is that you see a much larger percentage of younger people the first few weeks of a surge, and then that translates to the older people, and that kind of makes sense because the younger people eventually, no matter how much we're trying to protect the older populations, it starts to spread into the older groups. So I think there's a mobility graph as well. I know Dr. Cabrera has shown this before, but just so people can see what we're looking at here, even with the PCOR 1 lockdown in mid-August, our overall mobility only dropped to about minus 25-30% or so. And you compare that to where we were back in April with the first PCOR, we were down at 50% less mobility, at least by driving statistics, for weeks on end. So we never ever came down to the levels that we were, and that's why our numbers didn't go down to the levels that we saw in June and July. It's because we were still out there in too many numbers, and not protecting ourselves, in the workplace. And then we had a couple of spreader events, and that allowed the virus to get into the community too much. And what does this say? Maybe it doesn't matter what the stay-at-home order is anymore. People just aren't going to comply well enough to be able to get our mobility down in order to drop the numbers. And that has some implications for what we should expect in terms of the case positivities and numbers going forward. We're now at 60 cases a day on average and 11% positivity. So.
Yeah, Doc. So that being said,
the next slide I sent you there, Jason?
Okay. Yeah.
There's a chart about total infected there too. So this comes from a website that I've been following. This gentleman, his name is Yuyan Gang. He's a mathematician who's provided the most accurate estimates of infections that you can expect and deaths that you could expect in your region. And he, according to his calculations, he estimates that Guam is at about 21% of total infected to this point, and that's I've mentioned that before. It's the only silver good thing, which is a paradox, is that despite the high numbers and the increase in deaths that we've been seeing lately, we're up to over 20% potentially, with pretty wide error bars. You can see potentially as low as 11%, potentially as high as 35%, but right in the middle there, about 21% of our population is immune, for lack of a better word. So that has implications in terms of being able to control the spread, even though we're not doing as good as we should be in terms of staying home and practicing social distancing. Perhaps just maintaining the status quo and even continuing to open up things, the numbers will stay where they are. Now, what can we tolerate with the hospital? I think 60 is barely tolerable. As you can see, the numbers at the hospital are barely tolerable. Once we get to 60 to 80 cases per day on average, our capacity will slowly exceed the hospital capacity. And we'll have to start looking at those secondary sites and overflow contingencies again. And I think did you guys have any questions about that or comments?
No, go ahead, Doc. Last graph here: infection fatality ratio of COVID-19 versus seasonal flu.
Yeah, so I just wanted to touch on this briefly because there's various opinions out there about the how dangerous this virus is versus the influenza. And this was a really nice graphic because it didn't just cherry pick one or two studies, or it really looked at a lot of different studies, and even though their methods are a little bit different and the numbers they arrive at are a little bit different, you can clearly see there's a big difference in the fatality rate. Or basically, if you get the influenza, what are your chances of dying based on your age? And same for COVID-19. You can clearly see that across most ages, especially over the age of 30, you start to see this wide divergence. And it is definitely a much more fatal virus if you're to get it as somebody over 30. This may be useful to some people to try to see that indeed this is a much more dangerous virus to get. So. Just wanted to share a few graphics with you, change things up a little bit.
Thanks.
But I think there's also I think there's some ethnicity data out there that public health is looking through. It'd be nice to see that in terms of the folks that have died so far. How does that break down in terms of Asian versus Chamorro versus Filipino or Micronesian? I've heard anecdotally that the deaths are disproportionately affecting Micronesians for whatever reason, but without knowing more information about that, it's hard to speak as to why that might be the case. And same thing with these dead on arrival patients. They must know more information by talking to the families and friends and coworkers about what their last few days were like, and what lessons could we learn to help prevent these type of deaths, because you'd like to think that they're preventable, especially if they're in folks that are younger. They shouldn't be dying at the numbers that they are.
Yeah.
When you see folks in their 40s and 50s,
Doc, we have a few minutes left before the top of the hour, but I wanted to give you the floor. Routinely, when you come on, you make some unfortunate predictions. And so what are you anticipating within the next week or so as far as testing positivity rate, positive cases, and lastly, but definitely not leastly, the deaths?
Well, I think it's going to stay about the same. I think that the daily positive cases and the positivity rate is going to remain between 60 and 70, and the positivity rate will remain about the same. And that's only because of our overall prevalence is at the level that it's at. We're not doing anything to make it go down. Things have been we haven't made any changes out in the community that would impact this in the positive direction, unless there's things happening out there that I don't know about. I think, I appreciate you guys. Every time, somebody leaves, you ask them, what's your message for the community? And that's wonderful. But I think that, it's really confined to your listening audience. And I think that we need to do a better job about getting the message out to everybody. And it's some sort of public service initiative to get the message to people, not to stay home if they're sick, to instill that trust in the hospital and their medical centers that we're gonna help people if they come in. This is one, I think, fairly easy way that we can try to impact the number of deaths that we may see over the next few weeks. But because the numbers haven't changed, the deaths aren't going to change. We're going to see 5 to 10 deaths a week, and that's just the way it is, unfortunately. And to some people, that's acceptable as we march towards a higher percentage of immunity in the population. But to some people, that's unacceptable. We should continue to try to save every single life we can as this race to the vaccine, moves forward.
Well, there you go. The takeaways: deaths, high positivity rate, high number of positives. We're doing nothing to change that. Thank you, Doc.
All right, guys.
Well, have a good
Stay
weekend.
safe.
You too. Take care.
Wash your hands.
Bye.
Bye. There you go, Dr. Peter Lombard. He's been crunching COVID statistics since the beginning of the pandemic. And, you know, as many times as we've had him on, he's usually, unfortunately, I mean, there was a time when I was happy he was right. Back when we were getting zeros and ones. Remember, he was saying, like, oh, we're not going to see the high numbers. But, you know, he shifts with the data, and the data shows that that's going to be like this. And apparently to the government, it's acceptable. I was chatting with someone. You're right. We haven't done anything to help bring these numbers down. We've done things to help bring them up. And so.
And again, you know, you don't need an executive order to tell you that you're safer at home. You just need to stay home and only go out when you need to go out, really. It's really just up to us to turn this around at this point.
I want to thank our viewers on KUAM TV for watching the show with us this morning. It's been a great show. Friday, very sobering. That's COVID, though, right? So thank you again to our guys in Master Control, Joe Sir, Jason Solis, Ken Janier, for streaming the link on the Breeze 93.9 on KUAM TV. We're going to say bye, but we want you to jump over to our Facebook Live feed. Of course, you can also get us on the radio. We're 93.9 FM. And we're streaming KUAM.com and the KUAM News app. So again, to our viewing audience on KUAM TV, my name is Chris.
I'm Bree.
Hasta Hejos. Back here again, we're KUAM FM in Hagåtña, Guam. More of the link on the Breeze coming up next. Good morning, Guam.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
Pepsi Guam Bottling, a local company. We produce your favorite products right here on island, like Pepsi, Mountain Dew, Hanum, Chamorro Punch, Tropical Ice, and more. We've invested millions into local production and will continue to upgrade our facilities and provide local jobs so you can truly buy local. Our long history of producing the freshest and best products will continue. This is our vision. Pepsi Guam Bottling.
Your generosity can change lives. Disasters won't stop during this global pandemic, so neither will we. The Guam chapter of the American Red Cross is calling on the continued support of the community to assist with their mission of providing disaster relief and recovery efforts, military family support, and life-saving training and certifications. In times of emergency, our support will not waver, and we pray that your support of our efforts will continue as well. We invite you to join us in commemorating our 20th annual signature fundraiser virtually this year by supporting the Red Ball in a Box. We will be delivering special red boxes, which include a 4-course dinner from Micronesian Chefs Association and wine to our patrons and sponsors. As a sponsor, your company and message will also be featured in a special television tribute to the Guam chapter of the American Red Cross. For sponsorship opportunities and more information, please call 688-0280 or visit our Instagram or Facebook page. Let's support our community. Though we're apart, we're still together in generosity and support.
Celebrate National Pizza Month with the Pepsi Pizza Report. Pepsi helps celebrate this tasty month with an easy way for you to win Pepsi and pizza. Post a photo of yourself enjoying your favorite Pepsi beverage to KOM News or Uno Instagram or Facebook pages to enter to win Pepsi and pizza from one of our pizza sponsors. Catch the Pepsi Pizza Report every Thursday on KOM News' The Link Morning Show and on the social media pages of KOM News for reports, tastings, and everything pizza and Pepsi.
We got your 6
at 6 a.m. with the link on Breeze 93.9 FM. Bree and I connect you with all the latest news and information you need to know to start your day.
Then check back with Guam's news leader at 6 p.m. for the day's top headlines with KUAM News Primetime.
From 6 a.m. to 6 p.m. and everything else in between with KUAM Digital, we got your 6. Amy writes, they should offer 5% off in establishments if you have the COVID alert app or something to get people to download it. John Borja writes, contact tracing obviously failed if it took rumors and innuendo for public health to look into the cluster from the retailer. Teresa writes, you can't gain the people's trust when we are not being told the truth. You think we trust public health? JB Munya writes, who dragged you out of your homes against your will, drove you to these retail stores, then dragged your butts into these stores and exposed you to the coronavirus in those retail stores? Yeah, shame on them. Amy continues, public health can only step in once they get info from private clinics. They need to speed up passing along their tests. Patgun Guahan writes, employees should have the choice to be at work during this pandemic if they are considered essential employees without getting a disciplinary action for their family's safety. Elliot, please, please, please just stay home. That's the only way we can get back to normal. Gina writes, an epidemiologist, Dr. Ann Pobutsky, said, coronavirus is likely to be around with us, all of us on this planet for a long time. If not now, then when is a good time to shift the conversation to living with COVID? Flatten the fear. Marie writes, living with COVID doesn't mean everything opens. It means everyone does what they can to stop spreading the virus. Clearly, people are not doing that. Bernie Ann writes, the only way to slow our virus is to stop sending people home when they get affected. Keep them in one place and not send them home, because if you send them home, obviously the families are going to get the virus too, and that's what we're seeing. Yeah, so keep your comments coming. We're watching them. I want to go with Gina's comment here. Time to shift the conversation to living with COVID. I think that we've already turned the page and are doing that. As we're in a PCOR 1 lockdown, where you could basically do anything, you could go anywhere, you could buy whatever. And, I mean, even the doctors on the PAG say that the only way to really flatten this surge that's been going on for over a month, I mean, we've been surging since August. It's October.
How many weeks have we been in PCOR 1?
Since August 15th or,
7 weeks?
Yeah,
Right?
Yeah, it's
Next
crazy.
week's going to be 2 months.
Yeah, so obviously it's not working. So why do we keep doing things to make it worse? I don't know. Where's the governor? Where's public health? These are very valid questions. We're trying to do our part, guys. Going way back to the stay home, to wash your hands, to wearing your masks. We take the virus seriously because, like you, we have loved ones that, if exposed, could lose their life. People younger than me are dying from this thing. So we're doing our part. I just really wish that we had more of a partnership with the government of Guam. I mean, for public health to not even come on this show, which has the biggest listening audience, to not even come on for a whole week. I mean, when we're seeing high numbers of positives, high test positivity rate, high number of deaths. Communications 101, maintain a presence. Governor, it's like they gave up on us. That's how I feel. They don't even want to do a freaking press conference. Why? Because they might get asked a tough question. I mean, damn, we get the lieutenant governor on here. We ask him a tough question. You know what he does? He doesn't get mad and bite your head off for 30 minutes. He answers the question. Answer the question. It's ridiculous. You don't hear our people just saying, where's the governor? Where's public health?
I hear a song coming on.
You guys really don't want me to start writing songs, because I'll tell you, humor and satire, that's how you really...
We might have to do a duet.
I mean, it's just reached the point where, again, I was talking to feel like we don't even have a governor. The trust, that's the problem. No one's listening to these executive orders because there's just not a lot of trust. I mean, for the most part, a lot of us are kind of on the same page. We know what we got to do, right? But when you have the government saying, oh, it's safer at home, but hey, go do all this stuff, and hey, do this, and hey, do that, and you don't hear from them, Mosqueda, and check on us? You don't even want to check on us? Dude, we're in a PCOR 1 lockdown, and we haven't had a press conference in what? How long has it been?
So long, I can't remember.
I can't remember, and I'll tell you something that's very frustrating for me. In a lot of ways, it's unfortunate I'm kind of happy we're not having press conferences. Because when you get in there and you ask the governor a basic question like, what could we have done better? She gets all offended. That's the question I asked last time, and it was like 30 minutes, chew out Chris Barnett. What good does that accomplish? I mean, if you were going to be the governor of the island of Guam, you asked for this. This is the life you chose. Yeah, it's unprecedented. We get it. It never happened before. We get it. But it's on-the-job training. We're all doing the OJT right now. We're all figuring this out. It's unprecedented for all of us. But I'm not the governor. I didn't go and run and tell you guys that I'm going to take care of you. But we're trying to do our part. It's frustrating, though. The governor won't even come on this show. I quit asking. It's so unfortunate that we got to get, I mean, no offense, Crystal, but I mean, Crystal Pacos and Augustine is not the governor. She's got to go and run around to 20, 30 different people to get the answers before she can come on. And I just don't get why they don't get it. It's pretty simple. The reason why you're getting your head bit off of these press conferences is because the media doesn't see you for 2, 3, 4 weeks at a time. You don't want to have a press conference, but you want to have a virtual proclamation signing, and then you want to tell the media that they can't ask any questions about COVID because it's going to ruin your little proclamation signing party? COVID is all we want to ask about. We don't give a damn about a proc signing. People need to know how you're going to keep them safe, how you're going to keep them from dying, how you're going to keep them from catching this virus. Sorry. Just about had it. Just about. Almost. I mean, really, I just can't. I don't understand. I really don't. I mean, you're the leader of this island. You got to get out here more. There was a point where people really were in the governor's corner when she caught COVID. The sympathy was at an all-time high. She undid all the damage and all the negativity of the first lockdown when she caught COVID. We rallied around the governor. She came on and we were like, man, we're praying for you. We're rooting for you.
And now the people need you.
Yeah.
And where are you?
Where are you? Taigui Lai. Taigui. It's 8:11. Let's get into the KUAM News Zoom room where we have Art Perez who comes on the show. Thank you, Art.
Hi, Art.
Buenas.
Hey,
good morning.
Thanks for,
morning, Chris.
calling in.
No problem. My pleasure. Thank you for allowing me to get down the air and speak to our people.
Right on. We definitely appreciate you on here. And we brought you on because I know that there was a no disconnection policy for PCOR 1, but I'm not even sure if we're in PCOR 1 anymore. So I don't know. And so if we're in PCOR 1, but we threw all the PCOR 1 rules out the window, I'm just wondering, did you guys follow suit? And you're like, okay, everybody's open? Well, okay, time to start cutting your power.
Well, actually, Christian, the last time we spoke, we gave the deadline. We gave the July deadline about coming in, calling in, communicating with the authority, both authority, water and power, to make a payment arrangement. And for the most part, since the last time we talked, that's been very successful. We've had a lot of people private message GPA on Facebook, call in, or even when they were able to communicate with the authorities, come in and make the payment arrangements. Now, I will confirm there have been some disconnections. You need to, at least at some point, send a message that, you know what, if we don't hear from you, we can't read minds, and we need to disconnect an account that we've had no communication with. And lo and behold, they come in and they make a payment arrangement. Now, our reps have been, they've been given a lot of tools to work with these with all our customers. Even the CCU and executive management have put forward a 12-month payment plan on a case-by-case basis. And for residents and businesses, that's been the case. Unfortunately, there's been some businesses that's closed down. So those accounts, we have to close out. There's been some customers that are still experiencing those financial problems. And, we understand that. We read the news. We hear from our relatives. We hear from friends. And even some of our family members are going through that, unfortunately. But we will work with you. We understand that PUA payments are slow, and when they do come out, there's a long line at the post office to get them, or the banks and so forth. So, but that line of communication has always been open for water and for power. Like for GPA, we open up emails, we open up the private messaging. Even the call centers have been working long hours to get them in. But we just want to thank our customers, though, the ones that did come in and make the payment arrangements, or who've continued to make their arrangements. Thank you very much for continuing to maintain your accounts and make those payments and abide by the payment arrangements. You know, that's really I know we're going through a hard time, and we're really grateful for that. We can continue operations and still respond to that. So a big kudos to coming out on KUAM and helping us spread the word in this case, to get people in and to get them on payment arrangements. So we did have a big uptick from the last time we met in that regard.
So the response, you had a good response in terms of these payment policies, people that have signed up, or I mean, like, are you talking like half of?
We've had a very good response to them coming in, and you know, Bree, it's available to them, and we will work with them. We understand. Like I said, I can't help but keep saying this. You know, we will work with customers and make sure that we'll do as much as we can to keep the power on. We've rolled out some services to make at least this period a little bit more, you know, how to adjust to it. But at the same time, we want to say there's other tools that are there. Our conservation messages. We know you're staying home longer, so your energy expenses may go up. We have conservation messages. We have My Energy Guam that you can sign up for and know what your power bill is going to be before you even get it. You can monitor your consumption. We rolled out power alerts so that your virtual learning gets interrupted with these unscheduled power outages that still do happen, unfortunately. You can find out and have that documentation to present your school administrators or teachers that, you know, hey, you know, for a short time we were without power, so we couldn't log on to virtual learning and so forth. So we want to make sure that we put these tools out and get the word out. And you're right, Chris, getting the word out, talking to you guys, to KOEM and so forth like that has been a very good relationship with us. And for water and power, we still want to keep those lines of communications open for customers. And we need to hear back. You know, that feedback on what we're and how we're doing and so forth is important to us. So whatever feedback we get from customers helps us improve the service as well. So that two-line communication is very important to maintain.
With the disconnections, so that's just in situations where you guys have just not heard anything from customers.
That's correct. And you know, and Bree, you know, if a customer is gonna get their PUA check late, you know, they call us up. I mean, the feedback I'm getting from customer services and their management team is that they give us a call, let us know. And then, you know, lo and behold, in the paper, it just says that, you know, PUA late instead of every week, maybe 2 weeks. So that check may be coming in a little bit later. And we understand that. And we'll take that notation, we'll put it down in the account, and then we'll work with the customer. And they're very good about coming in to make sure that they put some payment on their account to keep it active.
So where are you guys in terms of being open? What's open over at GPA under this PCOR 1 point?
Well, the drive-thrus have always been open. Our call centers have been open, 647-578789. So they can call in, make the payments over the phone, contactless payment. If they have to drop off plans, if they have to turn in applications, like let's say their Guam Energy Sense rebate applications, you can drop those off at customer services or make an appointment to drop them off. And then even engineering construction plans, there's protocols in place for customers to do that drop off plans, turn in the applications. On our website, all all the points are there for you, like a checkoff list to make sure you turn everything in. And again, we monitor our social media page and our emails a lot, just to make sure that we can maintain contact with customers. And it's been working. It's been working. Without having to come in and do your business with GPA, I think now we're going to make more investments going in the future about how we can better improve that communication link with our customers, not having to come in at all.
So you guys have been able to pivot and offer your services electronically.
Pretty much, yeah. Pretty much, yeah.
Well, Art, during this time of year, especially maybe starting like next month, we start to see these announcements come out from GPA about Christmas lights and safety and all that. Are we anticipating doing the same kind of thing this year? What are you guys expecting with the holidays coming up?
Well, we are going to expect that, Chris. And that's what I like about Guam. We could be going through so many things, but there are the little things that we're going to make sure that we take care of. I mean, like for my family, we're even thinking, we can't get the grandkids and the kids all together, but darn it, we're going to have a Christmas tree just to regards.
Darn it!
Put out the artificial tree and all that. Put out the lumen as much as we can, but that's for every family to decide what they need to do. So long as they maintain their distances and keep themselves safe, I think this Christmas we're going to see lights go up, and we can't stop that.
How about COVID positives? Have you guys had any additional employees at the utility test positive for COVID that we don't know about?
No, I have not heard of any. Our internal communications would notify employees about that, and you know how that works. And once we do it internally, it's going to be reflected externally. And what's important to us is that we maintain the safety protocols for our critical operations, like our dispatch and our power plants. Once those areas are affected, it's going to be it'll cripple GPA in terms of us to be making sure we can still transmit, distribute power. So those are areas where we take extra caution, and throughout the authority we make sure the PPEs are in place, the protocols, the hand sanitizing is there for employees who need it. And then even our HR has been, all been trained on what to do and our protocols as in partnership with public health. So we take it very seriously here at GPA and also at Waterworks as well.
Right.
All right. Thanks a lot, Art. By the way, is there anything you wanted to say about your redesigned app?
No, just if you haven't signed up for it, please sign up for it. There are other services that you can avail. Just look at our website. The one I like to keep promoting is the My Energy Guam. I mean, I love how you can tell what your power bill is going to be before you even get it. That's a free service. The power alerts is there. You can sign up for that. And that number, that 1-800 number that you might get and think that's not legit, that is a legit bona fide number for. I know it comes from off island. That's how we're networked, but it is a bona fide legitimate number. And please avail of that service. Power alerts. All you need to do is make sure that your mobile number is a primary contact on your account with GPA, and you'll get those power outage notices for affecting your area, your home or business.
All right. Thanks a lot, Art.
Thank you, Art.
Well, thank you. Thank you, Bree. Thank you, Chris. Take care.
Stay safe.
Wash your hands. Yeah, and everybody, they want you to plug in your Christmas lights, okay? He was like, I love that time of year, Rony. All right, Art. Okay, see you. And yeah, it's a little weird because I always host GPA's Christmas party. Like I've done it the last how many years, and
virtual.
Haven't hosted anything. It's crazy. I just wanted to kind of share this with you guys as we had interviewed the wife of Renee Tamunda. They are laying him to rest today. I just got a message from one of my friends in Customs. They're doing a final salute at the airport. Departures around 12:45-ish. To be followed by burial at a Windward Memorial around 2 p.m. And again, as you guys may recall, Renee Tamunda, one of the 5 customs officers at the port who contracted COVID in the line of duty. He's only 45 years old when the virus took him. No underlying conditions. Okay, and so again, our condolences. A very, very devastating interview that we had with Renee's wife and his brother. Ray. And so our thoughts and prayers are definitely with them this morning, as they are with Melinda Sanchez, who we're going to bring on next in the KUAM News Zoom room here. As there's just so much going on, Melinda, with this COVID, and you know how it is with just COVID. It's like one blow after another. But when we got the news that your son Zach had passed earlier this week, I mean, it just left a lot of us I mean, kind of on the floor. And first of all, we just want to offer our condolences to you and the family, and just know that a lot of people, and I never got to meet him in person. We did the Zoom thing, but so many people I talked to who knew him just talked about what a light he was, and what an example he was. So, in a lot of ways, he's still here, inspiring people to this day. So, Melinda,
I actually have known Zach since he was little, right? When he was going to school over at St. Anthony's with Tyler, the two of them would do plays and stuff together. So yeah, it really hit hard when I heard about his passing. But we got word that you got something special, a reminder from the last time, I want to say, you were on the show.
Yeah, we were just doing busy work here, trying to get Zach's wishes in order for what he wants to do, and we got a knock at the door, and postman had just delivered an envelope, and it said it had his name, and it said the University of Colorado Boulder, and I opened it up, and there was his diploma. And he wanted to make it official. He wanted to make sure I knew that he did the thing and he did the work. And he was sticking it to me too. He was saying, see, I told you I could do it. I told you. Even though you pushed me and I didn't want to do it and I got tired and I still didn't want to do it. But at the end of the day, he did it. And he wanted to make sure I knew that he did it. And that was a good message and a sign for me that he is still here and he's doing his thing, and to tell me that he's okay.
That's
and
one
that
of the
he's soaring high.
It's one of the things that we talk about when we say what an example he was, because when we had him on and he, finished his school and he was going to get the degree, I think for a lot of people out there who may have been struggling with their schooling, to see that Zach was doing it, living with cancer and doing the thing, I think a lot of people said, hey, you know what? If he can do it, I can do it too.
We've had a lot of people that have reached out, even when we had the drive-by and we had the interview with you, and that mentioned, they're like, man, you're making me look lazy. Like I don't I don't have any excuses. Like I have to say, oh, I really don't want to do that today. But man, Zach had just had chemo. Zach had, a rough day today, and he still showed up and did the work and finished. And now they used him as a motivation for them, or a kickstart for them to keep going. Every day they wanted to live as hard and as lively as Zach tried to live his, even to the very end. He controlled everything to the very end.
You said that he had some wishes and you were preparing for it?
When we found out that, that the plans weren't going to be the plans that we had hoped for.
Yeah.
You make other plans. And so that's what Zach did. He made other plans so we wouldn't have to worry about what he wanted. Worrying about what he wanted, and how he wanted to be laid to rest and celebrated. So he wrote it all out. He had it's his final production notes for us. So he had wishes on how he wanted, who he wanted, how he wanted things done, what music. He even had it down to, okay, you're gonna have this song played and cue tears. I'm like, you're cueing our tears, Zachary? Really? You're cueing our tears? I don't even think that's possible. I think we'll already be laughing and crying and everything. So he had it pretty much laid out for us, so we wouldn't have to worry. But he also, when he wrote it out, it was as if though he was having a conversation with us. So as we're reading it, we were laughing because it was like, I want this, this, and this, and this, and in parentheses it would be, I'm serious, Nathaniel, or I'm serious, Mom, you do this for me, and stop rolling your eyes, or stop giving me this. And I was like, he acts like he's talking directly to me. Like, how did he know I was going to say that? So he kept his personality and his sass all the way, even in his plan notes to us.
I don't want to read this post here because when I got the news that he passed, the first thing I did was look up your Instagram, and there's a picture of Zach with the wings and the purple wall, and you write, some days cancer has the upper hand. My angel gained his wings today, but he's rooted in our hearts. He never forgot where he was from. Zach didn't lose anything. He did everything. Everything asked of him. Soar high, Zach. Thank you for you. Hashtag Zachy wins.
He won, and he still continues to win because he showed up. He put his faith and his physical body in the hands of other people to try to make him better, and he did everything asked of him. When we started and they said, we just need to go 8 rounds. We went 8 rounds, and they said we need to go 8 more. We went another 8 more. Even though we couldn't get a definitive or certain end date to when his fight would be over and provide us the positive result that we were hoping for, he did everything asked of him, and he won, and he did everything his way. He didn't go nicely every day to chemo. He didn't go nicely and feel nicely every day after chemo, but he did everything asked of him. Everything asked of him, and he always remembered where he was from and all the people back home that were cheering him on and rooting for him, and then all the people that found his story inspirational or somehow impacted them in their lives, that he somehow gained more friends that he didn't even know he had all over the world. And in that manner, Zach won because he was able to make a difference, and that's all he wanted to do. Even after he graduated and when he wanted to start his career, he wanted to just make a difference in someone's life. He wanted to make a difference and deliver a message. And Zach's message is, people remember what you said, what you did, but most of all, they'll remember how you made them feel. And Zachary always made you feel better after talking to him. Always made you feel better. He'd bring the laughter, and he'd bring the smiles. Sometimes he'd bring, a little bit of irritation, a little bit of nudging, but at the end of the day, it'll always be laughter because you can laugh at it because Zach was goofy like that and dramatic at the same time. So Zach won. Zach won.
He was a warrior. Like you said, he inspired so many people. You shared the message that he wanted people to know about him. What is the message you want people to know about him?
Zach's beautiful spirit was larger than his body could hold, and was much larger and fuller than cancer was. So he wanted everybody to know that every day mattered, and let your spirit shine, and go every day in color and see it in color. And if your color happens to be pink or blue, or in that day sometimes it's going to be black, then just do you. Zach was all about being himself unapologetically. He was just himself unapologetically. And that's how you have to live your life. And that's what he wanted people to know.
Min, when we had you on and Zach had, finished the schooling and you guys had decided that you were just going to come home and discontinue the chemo, did you kind of begin preparing for what could have been goodbye?
I was just telling someone that, when you realize that you're given the information and you make the decision that, okay, I'm going to do this my way. And when we decided to come home, I knew what Zach wanted. He just wanted to come home. We had some plans in place as far as mentally. You're never prepared emotionally. But we knew that coming home would be a place of comfort and finality, because coming home wasn't about a curative option. It was about keeping Zach happy, giving him what he wanted, and keeping him comfortable. So we had some plans, but it happened a lot quicker than we thought it did, and that's because the body just was tired. And so we knew certain things, and Zach was starting to put things in place and make sure people knew how much he meant to him, and he also knew what people needed to do. He started already delegating and putting things in motion. So he was the director all the way to the end.
Amanda, the outreach, right? The support. I mean, so many people just reaching out to you and Zach. I mean, not just now, but before this. What would you have to say to those people who have been there, who feel like they've been there with Zach for this journey?
We're absolutely grateful for everyone's support. We're blessed to have come from a community and an island where our hearts are bigger than the island itself, and to come up and then to connect with other people who are not from here and learn about how to be able to support. And we're extremely grateful and extremely blessed to have the support that we've had, and to have had their help to lift Zach through this entire journey. So I want to say thank you, and live every day and make every day matter, because tomorrow's never guaranteed.
Mindy, I want to thank you for coming on to speak with us. I know that it's a tragic time for you, and we actually have one of the clips you sent of Zach singing, so we're going to let you go, and then we're going to throw this clip out there and take a break. But again, if there's anything we can do, is there any message you want to get out or anything about the service, don't hesitate. Shoot us something. We'll get it out, okay?
Thank you so very much, you guys. I really appreciate it.
Wago Mossman.
Bye. Take care.
And so we're going to pop this clip up here, Jay? Mm-hmm. Okay.
When you're not strong, and I'll be your friend, I'll help you carry on, for it won't be long till I'm gonna.
I think you know the rest. We're going to take a really quick break, guys. It's 8:37 on the link. It's The Breeze 93.9.
With tons of delicious nachos.
Pepsi Guam Bottling, a local company. We produce your favorite products right here on island, like Pepsi, Mountain Dew, Hanum, Chamorro Punch, Tropical Ice, and more. We've invested millions into local production and will continue to upgrade our facilities and provide local jobs so you can truly buy local. Our long history of producing the freshest and best products will continue. This is our vision. Pepsi Guam Bottling.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
Celebrate National Pizza Month with the Pepsi Pizza Report. Pepsi helps celebrate this tasty month with an easy way for you to win Pepsi and pizza. Post a photo of yourself enjoying your favorite Pepsi beverage to KOM News or Uno Instagram or Facebook pages to enter to win Pepsi and pizza from one of our pizza sponsors. Catch the Pepsi Pizza Report every Thursday on KOM News' The Link Morning Show and on the social media pages of KOM News for reports, tastings, and everything pizza and Pepsi.
Your generosity can change lives. Disasters won't stop during this global pandemic, so neither will we. The Guam chapter of the American Red Cross is calling on the continued support of the community to assist with their mission of providing disaster relief and recovery efforts, military family support, and life-saving training and certifications. In times of emergency, our support will not waver, and we pray that your support of our efforts will continue as well. We invite you to join us in commemorating our 20th annual signature fundraiser virtually this year by supporting the Red Ball in a Box. We will be delivering special red boxes, which include a 4-course dinner from Micronesian Chefs Association and wine to our patrons and sponsors. As a sponsor, your company and message will also be featured in a special television tribute to the Guam chapter of the American Red Cross. For sponsorship opportunities and more information, please call 688-0280 or visit our Instagram or Facebook page. Let's support our community. Though we're apart, we're still together in generosity and support.
We got your 6
at 6 a.m. with The Link on Breeze 93.9 FM. Bree and I connect you with all the latest news and information you need to know to start your day.
Then check back with Guam's news leader at 6 p.m. for the day's top headlines with KUAM News Primetime.
From 6 a.m. to 6 p.m. and everything else in between with KUAM Digital, we got your 6. Talked a little bit about the Sinania Mayor's office being closed because of, obviously because of COVID. So I reached out immediately to Sinania Mayor Robert Hoffman, who had told me that Mayor, good morning, first of all.
Good morning.
So, and just to bring everyone up to speed, so was it you and the whole staff was tested at 8 this morning, or?
We're still in line for testing at the moment. There's about 20 some cars in front of us. The front of the line, there's a few of my staff. Middle of the line, I'm somewhere toward the back, and the line just keeps growing. I guess the line is also for those that were contact traced by public health. So we're just all in this together, and hopefully we get negative outcomes on this.
Boss Mayor, can you show us? Can you show us a little bit of the line?
Sure. Let me see how to switch this out. There you go. So we're on the other side entrance of public health right now.
And this is Northern Public Health.
So we're, I guess, on the Gura entrance side.
Is this just your
Northern
staff,
Public
or
Health, yes.
who all is?
There's about everybody in our building that works there. So that's kind of where we were contacted by the contact tracers, and not just one, but 3 possible corona visits within a very short time frame span. So we took immediate action in our services. We contacted public health to get the meal delivery to our senior citizens, which is our priority. So they immediately took over. Within an hour, they actually were able to assemble a team, and we got the maps to them, and they were able to go and give the foods and stuff. So that's kind of where we were at there. And then we contacted a company, and they commercially sanitized all our areas. We sent staff home for self-isolation, and then we provided the information to public health just as precautionary and just for the public safety and the safety of our staff. We don't want to be saying, we should be fine. We seem okay. And then, worst comes to worst on this. So just out of an abundance of caution, especially for our senior citizens that we deliver the meals to, we want to make sure and ensure their families that everything is safe. So we're all getting tested today, and we should get the results hopefully tonight or tomorrow. Hopefully.
Where was the contact, though? Was it someone who came into the office, or was it your staff delivering meals?
One of them actually, one of them works. So we play host to a nonprofit in one of our buildings, and one of them actually has it there. And so they got it from a family member. And once we were able to find out, they informed us, and we actually scheduled the cleaning for that side of the building. But the person also frequents our office and some of the common areas. And then the same thing, on yesterday, as well as somebody who's very known to many of us, also kind of got, we're closed for general business, but this is somebody that's been around us majority of the time. And it wasn't only till a few minutes of being within our presence that they actually got the calls informing them that they were COVID positive. And so, they were asymptomatic. So just out of precaution, and we were within a very good range for about more than the allotted time. We decided let's get this tested here. So, and then the other one is one of them is one of the family members of one of our workers is COVID positive, and that family member came to work every day, hangs out with all of us, and is with us. So, we wish them well, and we wish them a speedy recovery.
Did you say Gumamami? Is that still one of the offices there?
Yes. So that's our only nonprofit that we host. So it was in Gumamami side of it. So, but they're already on the tail end of that. So it was, and the person at Gumamami did not have any contact with any of our consumers. It's just an office of 3 people there, and so those other 2 are self-isolating, and they're not showing any symptoms from the time of their exposure.
How are you feeling, Mayor?
I'm feeling okay. There's a lot of anxiety. I guess, once you kind of, it's weird, I would say it's surreal to have one person saying, oh, you're within the range of 1, but to get 3 within a time frame, it kind of gets you like, did I get it? Did I breathe in the air, or did I touch something? So we regularly wear masks, and we sanitize the office with atomizer. We do what we can, but just out of, caution here, we just want to make sure. So yesterday, while they were doing the industrial cleaning, we couldn't enter our building for about 30 to 45 minutes. And we were out in the sun, and then, you get tired. I think I'm hot. I'm like, is the sun making me hot? Or, so it started to kind of feeling it. And so we just, the staff are supporting each other, and that's kind of, we're all here. We're all here, and hopefully we get the outcome. Hopefully nobody gets it and nobody has it here, but for the ones that do have it, that we're praying for them.
Yeah. Mayor, what did you hear about the large retail business that public health is not naming?
We got people asking us about that on our chats. They asked us about even food establishments, and these are floating around, and we've sent it up requesting for verification, and we didn't get any back yet. So we're still waiting for word from that. So it's very difficult. I still don't understand how the reporting. I mean, we can't seem to flatten any curve whatsoever if we don't get information.
Right. Yeah. So you didn't hear it was Kmart. Oh.
We don't know.
Because I tell you,
know.
Mayor, everybody who went to Kmart this week, right now, they all feel like they have chills and everything. Which is, I mean, if they come out and said it at the onset, we might be further along in, investigating whatever we need to there, if it's there.
Yeah, and that's the thing is that, the app is okay, but we were even asking about the COVID app and with the alerts work and on this end. We understand technology, but at the same time, a lot of people who get infected are also not activating the app in a way that it's supposed to. So it's, we don't know if that's, is it isolated? But, we've heard instances where people are not accepting the code that they need to punch in to activate the app, which tells them where they've been and uses the Bluetooth and all that technology with it. So I think that's, we really got to find a way to, close that loop and encourage people that it is safe and it is private to do this. So, to get 50 plus cases or more a day, it's hard to do it. And, this line is an example. I thought we were going to be the only ones here. We're like, okay, we got an appointment time. But when we talk to public health, they're like, oh, no, this is everybody that we've been talking to through contact tracing and all the other things. So we were like, oh, right. Wow. And it's a lot of people now. I mean,
How many
the line
cars did you
stretches
say?
way behind you.
How many cars can you see?
In front of me is about 20 or 30, but behind me, I would probably say there's almost more than 50 already, if not more.
So if you guys
And I know
joining
that
us,
these guys average about 200 plus tests a day.
right? Mayor Hoffman is in line to get tested for COVID-19 at Northern Public Health as part of a close contact COVID contact tracing investigation. Mayor, we got to move along, but anything in closing you want to add?
No, but work's going to still continue, so they can just contact us through our email, and then we'll respond accordingly. And we're going to try our best to kind of get back into operations Monday, depending. If not, if those that are negative, we'll return to work Monday.
All right. Thanks a lot, Mayor.
Thank you, Mayor. God bless you, you and your staff and your
care.
village. Okay, we'll see you. Light a
Appreciate
candle
it.
at
Just
St.
watch.
Jude.
Thank you. I
That's
will.
okay. Wash your hands. 8:51. Let's keep it moving in the KUAM News Zoom room. The sanitizing duendes are moving very quick. There's a lot of traffic going in and out. Please mind your distance. Please mind your distance. And we're back here with the hospital administrator, Lillian Posadas. Good morning, Lillian. Thank you for your time.
Good morning. Good morning, Guam.
Let's just get right into it. Could you update us on the COVID census, Guam Memorial Hospital? I saw that it's doubled in the last week. The number of hospitalizations has gone from 27 to, I think, 50. So where are we this morning?
52. We have again picked up, yes, several admissions yesterday. I think about 8 admissions yesterday. So yes, it's picking up again. People are coming in with the symptoms of respiratory fever, and so they're getting admitted. Of the 52, 12 of them are at the ICU level of care, and of the 12, 4 are on ventilator support. The total census in the house, not just the COVID that's picking up, but also non-COVID, our total census, combining both COVID and non-COVID, we are at 152. So it's kind of like, pre-COVID, our numbers. So, yes, it has picked up.
What happened? I thought GRMC was going to be the non-COVID hospital.
They are, and they're also, their censuses are picked up themselves.
Wow.
So, both hospitals, we are busting at the seams. So, people are sick.
You run out of beds yet? Are you close to it?
Well, we still have some open beds. And so,
Some, like 10?
What's that?
How many open beds do you have? I mean, what's the maximum
Well,
capacity?
we still have on the surgical floor, medical surgical, telemetry. We've maxed out our capacity for telemetry beds. We still have some beds in the Care 3 and Care 4. So
roughly how many?
I don't have the count right now. I have to go back into my calculator and get you the numbers of how many are open, how many are available.
Lillian, Dr. Hoa was on again this morning, and something that he's kind of reiterated all week is that people are waiting too long to go to the hospital.
Well, and as much as we try and encourage them to come, I'm sure there are some reasons as far as hesitancy to get the treatment for whatever reason. I'm sure there's a variety of reasons. But we try and encourage them to come as soon as they can. Um, we just want to make sure that they know that services are available here at the hospital for them to be seen. If they're not able to go to a clinic or a private clinic or public health, you know, services are available if they need to be seen and treated. And we want to give it that, we want to give them that assurance that, they will be treated, they will be seen regardless.
41-year-old COVID-related fatality early yesterday morning. Lillian?
Okay, what's that? Here at GRMC.
What was that?
Can you tell
I
us?
don't remember.
Yeah, just if you could just give us any additional. I know I always ask for any additional information on COVID-related fatalities in the last day. Do you have any?
I can't even remember anymore if we had one yesterday. I don't think we had one yesterday. I believe that was GRMC's. Right. So I don't have any information. I have no idea.
Lillian, I'm just on GMH's website, and it says that Guam's only public hospital with a licensed capacity of 158 acute care beds. Is that accurate?
Mm-hmm. Well, we used to think we were at 161, but we're always, the numbers are kind of changing. So with the Medicare certification, we were at 161 bed capacity. That was our certification. So how it gets changed, I guess I'll have to go back into check with our operations administrator.
Mm-hmm.
How'd that change to 150 what?
I'm just looking at your website. It says 158.
Okay. Is that the updated website?
I'm not sure. I just Googled Guam Memorial Hospital, popped it up, and then I got 158. But if you're saying that you guys believe it's 161 and you're 152?
161 is, right now our census is 152, correct?
Right.
That includes all of the, the MCH, the nursery, babies that that are in the hospital. So that's counting all the patients, inpatients, including newborn.
Lillian, when you come on and we ask about, bed space and all that, you routinely bring up the point that it's not necessarily about the number of beds, it's about the number of staff to take care of the patients in those beds. So where are we with staffing?
Okay, well, we have the 39 RNs from New West. We also have now, I think, 12 or 14 from the other staffing solutions agency that we have contracted since 2018. So we have additional staffing, but again, we're stretching our own organic staff. So because we lost some of our own organic staff, and I mentioned it before that from the onset of this COVID in March to September, we lost 20 registered nurses. And although we are recruiting some nurses, and again, we lost some more nurses just beginning of this month through retirement. Some of them have chosen to go ahead and retire. So we've lost several more nurses. So yes, we are challenged with our staffing situation.
Lillian, Dr. Hoa also said that we're not going backwards. So this is where we're at, this version of PCOR 1, where you can gather up to 5, you can go around and do all these things. That being said, we continue to see a spike in hospitalizations. If we don't do anything to slow the spread of the virus, as far as like tightening restrictions or anything like that, when do you anticipate GMH will burst at its seams? Because you're already close.
She said they were.
Yeah.
We are already busting at the seams. Both hospitals, we're full. We've got lots of patients, but we just have to continue to manage. And at the same time, the doctors are doing their part. That if the patients are stable enough and then can be released, discharged home, it's an ongoing revolving door. That the doctors are working with us to determine if these patients can safely be discharged home. So,
Right. So
yeah,
you,
it's a
so you
continued
guys are,
cycle.
yeah, you guys are bursting at your seams. Are you guys anticipating opening an alternate care facility?
The alternate care facility that has been established is the CIF, the skilled nursing facility up in Barrett Heights.
Mm-hmm.
And so we are going to start moving patients there today.
Okay. So, how many people are you guys planning on moving up there?
Well, the doctors are looking at, they're still assessing the patients, and so some already have been identified. Those who are very stable, who are on low flow oxygen, close to being discharged home, but still need to be, managed with observation. So the doctors are looking at the census, and we're going to start today, possibly looking at 4 today for now. And and a gradual progression of getting them in, getting them settled, getting them stabilized, and so we are looking at 4 on the list for now.
These are COVID patients, right?
Correct.
These are COVID.
Because that's what that facility is for. It's for COVID isolation
The ISOFAC.
overflow.
Okay.
Right. That's what it is. It's an ISOFAC.
But this is something you guys will probably be doing every day because you're
We're gonna
bursting
be
at the seams over there.
Yes.
Was it open because you need to relieve the pressure that's happening at GMH? You need the space to be able to bring in more people? I mean, is that...
That's one of the reasons why, so that we can then, we need to continue decompressing here so that as, patients come in, we can then make sure that we can get them into a room.
Wow, I'm really shocked I'm hearing it's opening as many times.
She's been asking about it since March.
It's happening.
Yeah.
Oh, my goodness.
Yeah.
Well, and we've been wanting to make it happen. It's just so many other things are going on that, takes priority. So we keep switching lanes here.
What about the transfer of patients? Do you have enough personnel to do the critical care transports?
What was that again? Say that.
Is doing the critical care transport from GMH, is that going to present any problems? Do you have enough personnel to do that?
We have our medical transport. We're not going to tie up the ambulance, the GFD, because they've got their own mission to respond to, emergency calls, and they're still getting called for to go to the homes to pick up individuals who need to be taken to the emergency room, whether it's GMH or GRMC. We don't want to tie them down from their mission. We have our medical transport service, plus our patient couriers who are certified and are licensed to drive the vehicle and contain the individual still who needs to be in isolation.
Lillian, in closing, we just got a comment here. Frontliners need our help. We need to stay home. What's your message to the people of Guam?
Again, to please continue wearing your mask, because science, we know already from science and from CDC that it's airborne. It spreads, and it can spread further than 6 feet. And this virus can linger in the air from minutes to hours. And so keep your mask on and keep your distance from people especially people you don't know. Because, this virus, like I said, it's very deceptive. It can jump into your system, into your, breathing system, and you can get infected. So protect yourself, protect your family. Practice wearing the mask. Oh, no, really wear the mask all the time as much as you can. Mm-hmm. And social distance.
Thanks, Lillian.
Thank you, Lillian. We'll let you get back to work. All right. God bless you. Stay safe.
Everybody.
Wash your hands. Okay. It's 9:02. We'll take a quick break, and we'll come back and discuss the vice presidential debates with Phil Leon Guerrero and Shonga Matata. And then we'll jump into our K-News Decision 2020 interviews next on The Link.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
Pepsi Guam Bottling, a local company. We produce your favorite products right here on island, like Pepsi, Mountain Dew, Hanum, Chamorro Punch, Tropical Ice, and more. We've invested millions into local production and will continue to upgrade our facilities and provide local jobs so you can truly buy local. Our long history of producing the freshest and best products will continue. This is our vision. Pepsi Guam Bottling.
Your generosity can change lives. Disasters won't stop during this global pandemic, so neither will we. The Guam chapter of the American Red Cross is calling on the continued support of the community to assist with their mission of providing disaster relief and recovery efforts, military family support, and life-saving training and certifications. In times of emergency, our support will not waver, and we pray that your support of our efforts will continue as well. We invite you to join us in commemorating our 20th annual signature fundraiser virtually this year by supporting the Red Ball in a Box. We will be delivering special red boxes, which include a 4-course dinner from Micronesian Chefs Association and wine to our patrons and sponsors. As a sponsor, your company and message will also be featured in a special television tribute to the Guam chapter of the American Red Cross. For sponsorship opportunities and more information, please call 688-0280 or visit our Instagram or Facebook page. Let's support our community. Though we're apart, we're still together in generosity and support.
We got your 6
at 6 a.m. with the link on Breeze 93.9 FM. Bree and I connect you with all the latest news and information you need to know to start your day.
Then check back with Guam's news leader at 6 p.m. for the day's top headlines with KUAM News Primetime.
From 6 a.m. to 6 p.m. and everything else in between with KUAM Digital, we got your 6. Friday on the link. Hey, want to shout it out to our friends at Pica's Cafe here for our curbside to crib segment, Bree. As we're gonna get Joe Sir on the breakfast cam. We're gonna be chowing down with some Pica's Cafe, and what we have here. This is cool. They're doing this family platter thing. Okay, they're doing for breakfast. They have chamorro sausage, fried rice. This is a half tray that we got. It feeds 8 people. Pretty sure you can feed more than 8 with that. $37. Joe, let's get on that chamorro sausage fried rice. Look at that, guys. Wow. And then we also have another family platter here. That's the one closest to you, Joe. That's a salmon tenactac OG style. It's salmon chunks, coconut milk, balsamic onions, string beans, and roasted tomatoes. It's kind of a healthier twist on tenactac here, and that will run you $35. Feeds a bunch of people. And we also have this is the one I like. I mean, I love them all, but Loco Moco is fine, right? I love Loco. Who doesn't love Loco Moco? But a Loco Moco platter, a broken up beef patty with 4 sunny side up eggs, sautéed onions and mushrooms, and peppercorn sauce. Wow, $33. They're doing a whole bunch of family platters at Pica's. Of course, they're on all the delivery apps. They also have outdoor dining available. They've also got a sandwich set. This is 8 sandwiches cut in half or cocktail style. You can choose from Korean barbecue, grilled tofu banh mi, Cali steak burrito, or the beef tenactac burger that's served with a side of potato salad and Caesar salad. They've got house-made meatloaf platters, bulgogi beef platters at Pica's Cafe. They're also doing soup and sides. They got carrot ginger soup, Caesar salad. This is a whole bunch of stuff. As you guys can see, we are very, very blessed to have a great breakfast after the show, maybe even during the show.
I know. I'm like sitting right next to it.
Yeah, Bree's going to be like, I got to take a break, guys. I got some stuff to work on in the other office. So remember, they also do the outdoor dining. Let me get that up here. Yeah, they have outside patio dining available. If you guys want to do that, maybe dine out. It's like eat out, dine out. You got it. Okay, Pica's Cafe. Check the family platters. They also got a cool website, and they're on all the food delivery apps. So thank you again, Pica's Cafe, for this week's Curbside to Crib. So excited for that. Next, we're going to kind of go in on the vice presidential debates, which were definitely a thing yesterday. We've got a little national package, and then we'll jump right into it with Sean Gumatato and Phil Leon Guerrero next on the link.
With plexiglass separating the candidates, Senator Kamala Harris slammed.
Celebrate National Pizza Month with the Pepsi Pizza Report. Pepsi helps celebrate this tasty month with an easy way for you to win Pepsi and pizza. Post a photo of yourself enjoying your favorite.
With plexiglass separating the candidates, Senator Kamala Harris slammed President Trump's handling of the coronavirus pandemic.
The American people have witnessed what is the greatest failure of any presidential administration in the history of our country.
Vice President Pence, the head of the coronavirus task force, defended the administration.
I want the American people to know that from the very first day, President Donald Trump has put the health of America first.
The vice president went after Harris for refusing to say whether a Biden administration would try to add seats to the Supreme Court.
Are you and Joe Biden going to pack the court if Judge Amy Coney Barrett is confirmed?
Let the American people fill that seat in the White House, and then we'll fill that seat on the United States Supreme Court.
While there were some interruptions and dodged questions, the tone seemed more civil than last week's presidential debate, and the candidates were able to make their points on issues including health care and fracking.
If you have a pre-existing condition, heart disease, diabetes, breast cancer, they're coming for you.
They want to abolish fossil fuels and ban fracking, which would cost hundreds of thousands of American jobs.
Supporters say the candidates did what they needed to do.
The Trump campaign has put a lot of stake in the outcome in Pennsylvania, and fracking and energy, if you're in Western Pennsylvania, is a big deal for jobs.
She used her time wisely to talk about what's at stake here. Families all around the country are worried about their health care.
The moment generating the most buzz, a fly landing on the vice president.
The memes. We'll go into the K-Way Zoom room. How does a fly steal the show for a vice presidential debate? Hey, we've got Phil Leon Guerrero, who did comms communications during the Calvo Tenorio administration and also is currently with the office of Democrat Senator Regine Bisco-Lee, and Sean Gumatato, again, who was the comms guy during the the Camacho administration. He's just worn a ton of different hats. I'm surprised he doesn't have 10 heads. So thanks, guys, for coming on here. We got Sean Gumatato, Phil Leon Guerrero. Good morning, Phil. Unmute.
That would be important. Good to see you again, Chris. Hafaday, Sean, always a pleasure to see you.
Hey, good morning, guys.
Let's just jump right into it. And I guess we'll start with Phil. Your takeaways from the vice presidential debate. Was it Pence or was it Kamala?
Well, I think that one of the good old standbys when it comes to presidential election, specifically the vice presidential debate, is really the goal here is to not take any votes away from your candidate. And I don't think that last night's debate did really anything to sway a lot of undecided voters. It probably helped fire up each respective base. But just on the facts, just on the following of the rules, I think that Senator Kamala Harris won the debate, if only because a fly didn't land on her face.
Sean. Sean?
Well, for me, I think it's debate tactics, right? I mean, if for all of us, we had a chance to really understand more about the policy, call it the policy direction of both tickets. And tactically, I think the vice president did exactly kind of what we were hoping that the president was going to do in the first debate. Obviously, that went out the door within 25 seconds or within the first 2 minutes of the actual debate. But in this case, there was a lot of, I thought was a lot of engineering by the vice president in terms of not only contrasting the record of Vice President Biden and also going to the, in all fairness to the senator, to her record, not just in the Senate, but when she was a politician in the state of California on a state level. So actually, debate tactics 101 was in full display last night.
It almost seemed anticlimactic, given what we saw in the presidential debate. Bree and I were watching, and after a few minutes, I was like, this is boring.
Well, I mean, I don't think anyone was expecting that it was going to be this titanic blow for blow. But the vice presidential debate, as we all know, it's that it doesn't really move the needle. I think when I looked at when just was recalling during the debate, the debate between Sarah Palin and Joe Biden many moons ago, that had a lot of interest. I think when you think about interest, I think it scored a lot of people watching it across America. I think it was like 50 million people watched last night.
Right.
But again, it doesn't move the needle at all.
Right.
Do you agree?
I agree, Chris, that it wasn't necessarily entertaining, but I do think it was educational. To Sean's point, Debate 101 was on display with candidates focusing on the policies, the records of their opponents and of themselves. So while it may not have been dumpster fire part 2, I at least think that there was tremendous value for the voters who are lucky enough to vote for president and vice president to at least see some of the contrasts in the politics and the policy, something tangible to hold on to.
So what do you think about next week? Do you think we're actually going to see a debate between Biden and Trump again?
I think the president already announced that he's more in favor of holding a rally. And I do think it underscores some of the very real and understandable concerns of many Americans out there that this president, his vice president, and the administration aren't taking this coronavirus pandemic seriously, that we know, we should have reasonable expectation that our commander-in-chief is still infectious at this point, that he's unwilling to change the debate to a virtual setting in order to protect everyone involved, and that he's still willing to go to and from a campaign rally with all of the infrastructure and staff needed to do that, and all of the potential close contacts with himself and potentially other infected people along the way. I do think it just is yet another example that this administration, to many people, is not handling the pandemic properly.
Sean?
I wanted to just to add in that the commission is supposed to be able to talk to both parties. I think that the story shouldn't be that the president wants to do a rally. The story should be that the commission didn't even communicate. They just made a decision. I think that you can expect that for next week's debate that there may be a change in that. It's more than likely they're going to have the town hall. I don't know how they're going to pull it off in person, but I think that the president would be kind of not a good sign for both sides that they don't get to have a venue for the people of the United States to hear both of their respective policies and what they want to see the direction of the country over the next 4 years.
Okay, I think that, sorry guys, we just, a very concentrated conversation. We've got to move along to our new KUAM News Decision 2020 interviews. Thank you, Phil.
Yeah, if you have family members that are lucky enough and privileged enough to vote for president, please let them know about the issues that matter to us here on Guam so that they can make their own informed decision when they go out to vote.
Sean,
Yep,
last
that's
word.
right. Everybody, make sure you go out and vote. Tell your family. I got my girls in the East Bay in California doing that, and my parents. I think everyone's kind of getting ready for the next 25 days.
Okay, guys, thank you so much.
Thanks, guys.
Be safe. Wash your hands. 9:16. Let's go ahead and let the sanitizing guys do their thing. Okay, stretching. Reminding you, the show is brought to you by Carrier 647 Cool, Calvo Enterprises, IT&E, and the Thrive Coalition, where it takes a village to raise healthy and drug-free youth. Come on and thrive with us. And away we go. The KUAM News Decision 2020 candidate interviews. Starting now, we have incumbent Democrat Senator Clint Rigel. Good morning, Senator.
Hi, good morning, Chris. Good morning. Good morning, Sabrina.
We have Republican candidate and former Senator Joanne Brown. Good morning, Senator.
Hi, Chris and Sabrina. Jason, how are you? Good morning.
And then we have also on the Republican side of the ticket, he's the former chief of police during the Calvo Tenorio administration, candidate J.I. Cruz. Good morning. Morning, Chief.
Good morning, Chris, Sabrina,
Good morning.
Senator Rigel, Senator Brown. Good morning, everybody.
And we'll go ahead and start the format, guys. We allow a 1 minute opening statement. We'll ask questions. You'll each have 2 minutes to respond to those questions. We will cut you when the time is up, and then we'll allow for a 2 minute closing statement. And so now we'll just jump into our 1 minute opens. And we'll start with the former police chief, J.I. Cruz, Republican candidate for senator. Chief, your 1 minute opening statement starts now.
Good morning, Guam. Good morning, everybody. I want to thank everybody during this election season for having me as their Republican senatorial candidate. I want to thank you for that. Thank you for your trust and confidence in having me as a candidate. And I hope to be able to serve the people of Guam as a senator in the 36th Guam legislature. What I bring to the table is I bring a career, I bring experience in the military, I bring experience in law enforcement, I bring education to the table, and I humbly ask for your vote on during this election season. Please vote number 8 on the Republican ballot, Joseph Iglesias, J.I. Cruz.
Thank you, Chief. And then we'll go to Senator Joanne Brown. Senator, your 1 minute opening statement starts now.
Thank you very much, Chris. It's very good to be with you this morning. One of the reasons that I'm primarily running is I'm just very dissatisfied with the leadership direction that I'm currently seeing in the Guam legislature, the lack of check and balance. And what I see is corruption in our government that is going unchecked and unreviewed by people in policy that continue to look the other way. So certainly after all these years of not being in the legislature, having previously served 6 terms, I certainly bring a whole wealth of experience, having been overall my government service for 30 years, including almost half that time heading agencies in this government from EPA to DPW to the Port Authority of Guam. So I'm certainly looking forward, if I get the support of the people of Guam, to serve again in this upcoming legislature.
Thank you, Senator. Senator Rigel, your 1 minute open starts now.
Good morning, everyone. My name is Clint Rigel. I'm running for re-election, number 9 on the Democratic ticket, and I'm running to focus on my platform, which is to make Guam green again. And what does that mean? People wonder, what does that mean? For me, what it means is returning to Guam's roots. And that means for thousands of years, the island of Guam and its people were self-sustainable. The people of Guam grew their own food. They didn't import anything. They created their own product. And I think during those times, they were very, very thriving. And I think we can return to a time when we're thriving again. That's why I want to focus on things like developing an agricultural industry, as well as other new industries on Guam. That's why I passed the Cannabis Industry Act to create a new industry on Guam. And that's why I also support things like renewable energy and was able to pass, along with my colleagues, a bill that requires 100% renewable energy by 2045. There are other things I want to work on, but specifically agriculture is a big thing I want to work on developing.
Thank you, Senator. Chief, are you playing the Facebook stream? Because we're getting a lot of interference from your feed. So if you guys are going to watch the stream while we're on the Zoom, it's going to create some noise in the background.
Chris, I'm sorry, can you hear me?
I can hear you.
Sure
Do you have anything open?
No, I don't.
Okay. Okay. So we'll just jump into the first question, Sabrina.
Right. You guys have 2 minutes to respond to all the questions that we will present. The first one, I'll start it off. Please specify whether you have participated in the following surveys: the one from the Action PAC, the Progressive Democrats of Guam, which is due today, as well as the Vigilance Committee, which is due today. If you have not responded, if you could just explain why, and if you have, why you felt it was important too. And we will start with you, Senator Rigel.
Sure. So the Action PAC survey, I did not respond to it. And the reason why is I felt it was unfair the way the questions were written, and they were yes or no answers. And those are not yes or no questions. So had they given an opportunity to allow for full answers, then I would have answered it. I did participate in the Vigilance Committee. I forget the exact name, but the Vigilance Organization's survey, because they allowed for full answers. So I gave my full answers, as well as the Progressives survey. They allowed full answers. Was there any other survey?
Those were the 3 that we were aware of.
Yeah.
To be honest, there's a lot. There's also a Guam Association of Realtors survey, which is very similar to the Action PAC survey.
Right.
Now, I didn't get the survey answers in on time, but I did participate in the Guam Association of Realtors forum that they held yesterday, which basically covered all the questions in their survey. Thank you.
Thanks, Clint. Chief?
Chief, you have 2 minutes starting now.
I answer the Action Pack survey. Again, I answered that because I felt that a lot of the questions that were being asked fall in line with my ideologies with regards to running for office, running for senator. I have formulated a response to the Progressive Democrats of Guam. I have yet to submit that. And I also answered the vigilance survey. Like Senator Rajel had alluded to, there's a whole bunch of surveys that are out there. And again, I answered those two right off the bat because I think they align to my ideologies and my beliefs as far as running for a senator and what I look to effectuate in the 36th Guam legislature. I must admit, though, that the PDG survey kind of, for me as a Republican and as I look at things to effectuate, has a very interesting slant, almost the same slant that Senator Rajel has about the PAC survey, the Action PAC survey. So I had to very carefully answer that survey so that it stays in line with my ideologies with regards to what I look to effectuate in the 36th Guam legislature. Thank you.
Thank you.
Thank you.
Senator Brown?
With regards to the Action PAC, I did not participate. I did not participate in the Progressive Democrats, and I will be submitting my response today for the Vigilance Committee. I'm one of the founding members of the Vigilance Committee, but I had to step down several months ago, of course, when I declared my candidacy for the Guam legislature. You know, one of the things, and certainly having been involved in a number of elections to the Guam legislature, one of the things I'm always mindful of is making sure that when I run and as I did in the past, when I was fortunate enough to be elected, I mean, when I walk in the floor of the legislature, I'm not there representing any special interests. And sometimes I look at some of these questions, even though there are a number of surveys that I participated in this election. There are a number of these surveys that are very slanted and very much orientated, obviously, to the agenda of that particular organization. And so if I don't feel that really gives me an opportunity to elaborate on what my positions are and how I see issues, I just don't participate. And I'm really not someone who wants to be bought and sold the moment I walk on the floor of the legislature. I mean, I'm there to represent the people. There's some issues of these organizations I may agree with, but there may be others that I don't. And I certainly don't want to be put in a box. Or have I ever sought? I do not have ever, nor have I ever in all the years I've run for office in the past, ever sought endorsements to represent any interests. I mean, I have to make sure when I'm there to represent the people's interest and review those issues as they come up, or certainly as if I'm elected again and fortunate enough, I'll represent those issues as they're brought forth. But I don't mind. I love the engagement, especially right now with our current pandemic situation. It allows us to interact. I am very appreciative of the forums that allow us actually to get on and Zoom and interact with organizations and their membership that allow us to elaborate. But my reason for not participating in those other two, I just felt they were very one-sided.
Thank you,
Thank
Senator
you,
Brown.
Senator. Next question. What letter grade from A through F would you give the Leon Guerrero Tenorio administration's handling of the coronavirus pandemic? And we'll go ahead and keep it with you, Senator Brown. Your 2 minutes starts now.
You know, one thing I do know, certainly having spent a number of years in two administrations, because I've had the fortunate opportunity to work for two governors, Governor Joseph Atta and Lieutenant Governor Frank Blas, and of course, Governor Eddie Bazacalvo and Lieutenant Governor Ray Tenorio. The burdens of government are heavy. I mean, let's not kid ourselves. No matter who's in office, the challenge of all the issues that you're faced with, and certainly with this pandemic, it's unprecedented for any organization, Government of Guam, to ever deal with anything of this magnitude. So just walking in, it's a tough job to begin with. I would give them maybe a low C. I mean, of course, people will just assume because we're in opposite parties, we're just going to say something negative. I think a lot of work's been done. A lot of work's been done by the healthcare professionals out there doing their work, trying to educate our people. And certainly we want to save as many of our people. It's unfortunate as we continue to look at the fatalities that we're experiencing. But I think one area they definitely need to work on is their public engagement, is making sure that they can get as much information out as possible. This whole issue, and I think it's wonderful that we have physicians in our community, certainly at this time, that want to give their advice and guidance because it's definitely needed by the government, definitely needed by the governor, even though certainly she does have a healthcare background. But I think being more transparent in how that information, how those decisions are made, because right now, from one day to 1 week to the next, we don't know what's going to happen. And I can't imagine trying to operate a business, have employees, and even if I make every step that I need to make, I get penalized with everyone else. So I think that now, as we have more information, we should be making more better educated decisions on how can we live with this pandemic, which doesn't seem like it's going to go away anytime in the near future, still function and keep our economy moving, because I really feel that that's an area where we're getting hit very severely, and we're going to have a very hard time recovering from it.
Thank you, Senator. Chief, you got 2 minutes to respond to the question starting now. Unmute.
Sir.
I'm sorry, can you hear me, Chris?
Yes.
Okay, thank you. That's a very good question, Chris. And I would say I would echo the sentiments of Senator Brown. I too would give this administration a low C, a C minus, with regards to the way they've been handling the pandemic. And I say that from that perspective, in that I know that the Physicians Advisory Group was very key and instrumental in providing information. And there were many other advisory groups and councils that were giving advice to the administration. But I'm not too sure, I'm not very confident that they came up with some kind of a plan to be able to deal with the virus moving forward. And I'm not sure that they reached out to the healthcare professionals stateside and other jurisdictions who are facing similar, if not the same type of situations on Guam. And then on top of that, like Senator Brown had alluded to, communicating that to the public, I think, is where there could have been room for that. And while I understand that there's no 100% foolproof plan, but there could have been decision points along the way so that as the dynamic of the virus continued to change, that the plan could continue to change as well. And again, that's a perspective that I see, that there was no real plan going forward, whether it's from the healthcare perspective, whether it's from the business perspective, whether it was from the government perspective, there was no real plan going forward. And I think that the transparency that needed to be added to that, so that the people were comfortable that the government was doing everything that it possibly could to deal with this situation, would have helped to deal with this. So again, I think that as we go forward, that's part of what we need to consider: developing a plan, being able to have a plan that's flexible enough so that we can adjust accordingly, and communicating that to the people of Guam.
Thank you, Chief. Senator Rangel, your 2 minutes starts now.
Thanks. Yeah, I have a different grade. I actually give them an A. And I know some people might think, oh, wow, that's crazy. You gave them an A. I don't care. I'm being honest. This is a very, very difficult thing to handle. And I say point out one jurisdiction around the world that has been able to handle this virus successfully. Look across the United States. The United States has like the highest numbers of coronavirus right now. Countries are banning travel to the U.S. The president of the United States, the most powerful country in the world, the president got airlifted to the hospital and pumped full of experimental drugs and pushed back out there. How well are they handling the virus? I don't think anyone's handling the virus that well, because it's so brand new, it's so difficult. No one really knows what to do. Everyone is just doing the best we can with the information as it becomes available. There's new information almost every week as science begins to unravel the details surrounding this disease. There are new, in the beginning, we thought it was just a few symptoms. Now the symptoms run the gamut. There's so much information it's hard to keep up with what exactly should be done. And in fact, public health policies are constantly shifting across the globe, depending on the country you're in and depending on what their experts and their leaders decide to do. So it's a very dynamic and very difficult situation. But I think overall that our government and our governor has done the best that she can with the resources we have and with the information we have regarding something that's brand new and something that's affecting the entire global landscape. Thank you.
Thank you, Senator.
Wow. During this pandemic, it brings to light, some people have said, it's turned out where we've seen government employees versus private sector employees. And what I mean by that is that, government employees, they've been allowed to stay home. They've been allowed to telework, and they continue to get paid. While you have private sector employees, they also have had to stay home, but some of them have been furloughed. Some have been laid off and seen a reduction in hours. Explain how you will be a leader for the people of Guam and not just the government of Guam, and provide relief to the private sector and private sector employees.
And we'll start with former Senator Joanne Brown. You have 2 minutes to respond to the question, starting now.
Thank you very much, Chris and Sabrina, for that question. I'm troubled with that as well. And even though certainly I've had my career in the government of Guam, and we do have a lot of good, hardworking government employees, I think this pandemic has brought to light how removed the government of Guam is from the people in general. The fact that we do have needs of the government and people have requests for information, we still need to facilitate and function, of course, do it in a safe manner. But if we're able to do it in many operations of the government, even in our community, there's no reason why we can't reassign other employees from departments and agencies that are considered non-essential to assist in areas where support is needed. And of course, contact with each other and the general public can be addressed, because we're doing that now. I mean, you guys are doing that in your studio. Every early morning you come to work, you're taking the necessary steps that you need to do to continue to do your work. I mean, gosh, that would be nice to stay home and get paid and not have to go to work. But when our community is suffering as it is, when we have so many people in the private sector that are losing their jobs or have lost their jobs and don't have an income coming in, and the federal money will dry up one way or the other. We're waiting in between to see, is Congress going to do another relief effort or whatever the case may be? But it shows you that the priority is not focused on protecting the government. Even when the administration makes public comments, oh yes, we have enough revenue. We have enough revenue to keep the government operating. No, we don't have to reduce government spending. No, we don't have to impact compensation to our employees. That sounds good, but that's not the reality of what's going on in the real world. And I think we see right now, I'm dumbfounded with the most recent budget. How could it be possible? We're almost passing a budget of $1 billion on an economy where such a significant portion of it has come to an economic standstill. And without that, getting that private sector moving, again, to generate those revenues, the downfall's coming. It's coming next year, and it's coming right after that, where we're going to feel the severe impacts.
Thank you, Senator.
Where those cuts, instead of managing
thank you, Senator.
it properly.
Thank you.
We'll move on to former Chief J.I. Chief, you have 2 minutes to respond to the question, starting now.
Thank you, Chris. That's a very good question. And I would tell you the perspective I would take is the same perspective that I took when I was the chief of police. And that perspective is considering the whole of the community, and that you cannot just consider one facet of the community called the government of Guam, or one facet of the community called the private sector. You need to look at it from a holistic point of view, and that all facets of the community need to be considered. And as a senator in the legislature, that needs to be considered. We need to look at and think about that. And Senator Brown alluded to some of that by considering those who have been affected by the pandemic, where they're unemployed or underemployed because of that. What can be done to be able to effectuate that so that they're not so underemployed? And how can we encourage businesses to open back up and continue to be able to serve our people? We talk about revenue projections and the shortfalls in the budget. Again, like Senator Brown had alluded to, I question the budget because of the fact that the projections are short. They're not meeting the mark. And if we don't look at the whole of the community and how that impacts everybody across the board, not just the government employee, because the government will not stand alone on its own, and not just the private sector and those who have shut down and those unemployed or underemployed, because you cannot thrive on federal assistance alone. We as a government, a legislature, need to take a look at that and figure out what we can introduce, what can be introduced to be able to help everybody in the community, not just the government of Guam, who have a relative sense of security, job security, but all parts of that. Our community. So I would say that we need to take a holistic approach, consider all facets of community, and be able to implement policy that's going to affect the whole spectrum. Thank you.
Thank you, Chief. Senator Rigel, you have 2 minutes to respond to the question, starting now.
Sure. Yeah, that's definitely a challenge. Is going to be the economy, and how do we help businesses and help the economy recover. But I do think that the government of Guam has been doing a lot. And with the budget that was brought up, we actually cut $60 million from the governor's budget. In fact, she vetoed the budget because we cut so much, and we had to override the veto. So I think we have been doing everything we can to cut and reduce spending as much as possible during this pandemic. In addition to that, the government has given out thousands of dollars through federal funds that have come through, but has facilitated those federal funds to private businesses through GITA, through various grants and loans and other programs. And quite a lot of money has gone out. The pandemic unemployment has put out a lot of money to those who unfortunately lost their jobs. Again, this is something that's very difficult to deal with. I mean, what we could open up the economy, right? We could open everything up, let all the stores open, let everything open. Then what happens if the virus runs through our community and fills our hospital to the point where our hospital can't handle it anymore, right? So we got to do something. You either pick opening everything up or you close some things down. We've had to close some things down to manage it, to keep it at a manageable level, and that's what we've done. And I know not everyone's happy with that, but there's not too many other alternatives unless you want more deaths on your hands, unless you want the death toll to rise. That's the only other alternative. And I think we've decided to keep the death toll as low as possible. And because of that, there's going to be some businesses that are going to have to just find ways to deal with it and apply for these programs that offer more funding. And there's a lot of federal programs that have offered a lot of that funding. And that's the best we can do at this time. And then look towards how do we get the island out of this COVID mess, get the COVID numbers down so we can reopen.
Thank you, Senator. Next question. Several candidates are running on a platform of fighting corruption that they say is going on in this administration. So please cite at least one example of corruption and how you would address that corruption through legislation or your role as a senator. And we'll go ahead and start with former Senator Joanne Brown. You have 2 minutes to respond to the question starting now.
Thank you very much, Chris, and I appreciate that question because certainly that's one of the main issues that I'm looking at. Certainly, should I be elected to the Guam legislature? And having been served in the Guam legislature, I've been a 6-term senator. I've served, like I said, overseeing 3 departments in this government of significant size and purpose. And I'm aware. I mean, you can look at the most recent situation that's happened this year at the Port Authority of Guam. I mean, Senator Agel's the oversight chair. A lot of people probably don't know that because I haven't even heard anything publicly with regards to over $3 million of public and ratepayer money being paid out to employees that did not fully go through the legal process to ensure that public monies were being protected. And I mentioned that when this administration started last year, because I started seeing the signals of what the agenda was. The agenda was to walk in and pay these people off. And here we are all these months later. And that's exactly what happened. This type of stuff going on that's going unchecked because of who knows who and who's connected to who and abusing public assets and public money and public resource, particularly during this time of challenge and suffering that our people are going through is not right. And certainly should we get elected, hopefully the people of Guam give us a Republican majority. If they're dissatisfied out there with the current leadership, then by all means, put different people out there and put me and my colleagues in there on the Republican side, because certainly one of the things we will do is create a committee specifically to look at allegations and issues of corruption and bring those issues to light in the people's house, because let's not kid ourselves. Our people are very much aware, but I think those issues need to be brought to light and appropriate action needs to be taken. If there's no doubt in my mind, there's been abuse of public resource that has happened. But at the other end, I think that information needs to be brought out and the people of Guam need to see it and hear it for themselves and then make that determination as to whether the people in leadership who continue, Chris and Sabrina and Jason, to look the other way, let them make that determination on their own when the information is brought to light.
Thank you, Senator. Next, Chief, you have 2 minutes to respond to the question starting now.
Chris, can I go since my name was mentioned?
Yeah, we can switch it up. Okay, so we'll go with Senator Rigel. You have 2 minutes to respond to the question or to former Senator Brown, whatever you choose.
Thank you. Yeah,
starting now.
So with regards to the Port Authority of Guam, right, these, I believe she's referring to employees that were reinstated. Now, they did go through a process. Those employees, there are processes in place. They went to the Civil Service Commission. In fact,
that's
some of
totally
these went
incorrect,
to
Chris. What he's saying, I'll tell you, I'm not here to
Senator Brown.
Some of these went to the court system. And the court. So these went to the civil service. They went to the court system. They were reinstated. That's why they were paid. They were told to be reinstated by the courts and Civil Service Commission.
Is that it? You still have a minute 20.
Yeah, sure. What was the question?
Cite at least one example of corruption and how you would fight it with legislation or in your role as a senator.
Sure. So legislation. I don't think. I don't think it's an issue of legislating against corruption. It is an issue of oversight and monitoring against corruption and ensuring that you catch corruption and find corruption and point it out. And I think I've done my best to do a lot of that. I think a lot of people didn't, the media included, didn't make a big deal about my push against the power plant. There's a reason why there's a push against the power plant, because here's a power plant worth $3 billion. You want to talk about money figures now? Some petty 3 million versus $3 billion of a power plant. That power plant was given to a company who blew up the old power plant at Cabris. That's how I fight corruption, is I look for these things that don't smell right and I go after them. Unfortunately, the power plant deal went through and it didn't smell good to me. Thank you, Chris.
Thank you, Senator. Chief, you have 2 minutes to respond to the question or anything else you want to respond to, starting now.
Thank you, Chris. I appreciate the question. And I see corruption as one of those matters that come in many shapes and sizes, many forms and fashions. But I will tell you that the biggest way that I see to be able to deal with that is providing transparency. There's got to be transparency. There has to be a mechanism that deals with the issue of corruption. Now, again, I take it from the perspective that these things need to be brought to light. When I was the chief of police, we had an internal affairs section, and there were many different mechanisms in place to deal with those types of things. When you ask the question, give one description of corruption, I would think that, again, the use of the people's money and how the money's being spent in recent months. And I think the procurement of how things we're bringing things into the government to be used as a result of what's been happening since the pandemic. I question some of that from somebody who's on the outside looking in. And as far as legislation is concerned, I think that we need to introduce legislation that mandates periodic reporting of different agencies across the board. So, and again, being the former chief, I understand what that process, or I can see how that would serve to be able to bring more transparency and mitigate the issue of corruption. Oversight is another issue, and Senator Rigel led to that. Should I make it into the 36th Guam legislature, then I would definitely look into mandating the periodic reporting of these agencies across the board, so that we can see, and working with the OPA, so that we can see that how they're spending the money that belongs to the people is being spent accordingly. And then providing oversights where, like Senator Rigel said, if it doesn't smell right, we need to oversight these agencies and ensure that kind of transparency. And that's how I would deal with this issue of corruption. Thank you.
Thank you, Chief. Sabrina?
Speaking of transparency, the Department of Public Health, they will not release information about businesses that have had or have COVID positive cases, but they do release businesses that have undergone COVID inspections, and when they find violations. It's on there, it lists, it's public. But again, when it comes to businesses that have COVID cases, they just won't let the public know. Do you feel the public has a right to know? And we'll start with you, Senator Rigel.
Yes, I actually do. I think they should. I'm not sure why they're not. And that is a part that I have had problem with, definitely, is that it seems inconsistent over when they say who's got COVID and who doesn't, or which businesses. And now I know it gets complicated sometimes with HIPAA regulations, and I'm not very well versed on the HIPAA regulations, but it does seem inconsistent when some businesses, like you said, they'll say that they've violated COVID regulations, but then they won't say who has it. So maybe that's where it gets dicey, is because technically if you say where someone has it, then you might be indicating who has it, and that might be a violation of HIPAA. I'm not sure. Versus someone who violated public health guidelines is different. It's not necessarily a personal health issue that's regulated by HIPAA. I'm not an expert on that, but I would like to see more clarity and have it be fair. And I do think people should know if a business has a lot of people infected, and a lot of businesses have just come out and said it. So yes, I do think people should know if a business has people that were infected, so that at least people can decide for themselves if they want to go. You don't have to say who at the business was infected, but just to know that there were infections at the business, then the public can decide if they want to go there or not and risk it.
Chief, we'll go with you next. You have 2 minutes to respond to the question starting now.
To answer your question directly, Chris, I would agree. There needs to be that level of transparency. I will tell you that I find out more from my WhatsApp chat rooms about what public or private businesses have employees who have tested positive for COVID than anywhere else. I mean, that's how pretty much we're getting that information. Why? Because we're not hearing from the right authorities as to that. Now, I agree with Senator Rigel that that HIPAA comes into play and that we can't violate those HIPAA regulations. But at the same time, I think that there needs to be a mechanism, which goes back to that planning question that I talked about. There needs to be some kind of a plan to move forward on how we deal with these types of things. How do we get this information out to the people? So like you said, Chris, the people can make their own decision about who they decide to, what private businesses they decide to go to. But if we don't get that information out to the people, we don't maintain that transparency, how are we going to know? But then again, it goes back to that, do we have some kind of a plan to deal with that? And I don't think we do. And that we need to give as much information as we can regarding this matter to the people so that the people can decide. It's the people's government. And that's who we need to be answerable to. And that's who we need to keep informed. Thank you.
Thank you, Chief. Next question. What could be done to...
Did Senator Brown answer?
Oh, Senator Brown. I'm sorry, Senator Brown. Okay, Senator Brown.
No problem, Chris.
You have 2 minutes.
I agree. I think there needs to be a process of keeping the people informed. And I certainly appreciate a lot of the businesses out there that have been proactive in announcing that they have had a case or cases and what step they've taken to mitigate it. So that people are aware. I mean, I think, the healthcare professionals keep telling us that assume everyone around you has it and act accordingly. Make sure you wash your hands, make sure you wear your mask, make sure you maintain social distance. But I do agree that the public health and the government in general has been inconsistent in one area. They're very well open to announce, for example, one of the churches. We all know who that church is early on because their names were used quite often. And then in other cases like the healthcare clinics, when they had positive cases of employees in their healthcare clinics and the hospital, they didn't announce it. I mean, I know the Vigilance Committee actually pursued that to finally make that information public, but they were not providing that. So that type of inconsistency, that's what makes the people leery about their own government, because the government's not consistent in providing that information. I think every step we take to keep people informed, and then they can make their own decision. Do they want to go and be a customer to that business? That's their choice. Because I know everyone is struggling with this, but as mentioned, I think the more transparent, the more open we are with our people, hey, we got to give them credit. They can make really informed decisions, but we need to assist and facilitate and make sure that information's out there so that they know what to do. So I'm very much that information should be provided to the public.
Thank you, Senator. Next question. Could the Guam legislature have done more during this pandemic? Many have been critical about the legislature remaining silent, but in your opinion, do you think they could have done more, or did they do enough? And we'll go ahead and start with incumbent Senator Rigel. Senator, you have 2 minutes to respond to the question.
The answer is we can always do more. It's never enough, no matter what. So, of course, there's always room for improvement. We can always do more, but I think we've done a lot. We've been in session like almost every other week. We're going to session next week, by the way. We've been during the pandemic. We were in session a few weeks after the pandemic. We were in numerous special sessions. We've addressed as many bills as we could come up with. There's only so much you can do from a policy standpoint in the midst of a pandemic, because really a pandemic requires a lot of executive response. As a policymaker, we just have to come up with policies that can help the executive branch execute things that would overall help the island and help the economy. So it's a bit limited in what a legislative body can do, but I think we've done the best we can. Like I said, we cut spending. In addition to that, we found ways to fund other things, and we just did our best, to to get through this pandemic. It is a very challenging thing. And I know some people wish we would have been, perhaps they say, more vocal. I think we did a lot. We did stand up, as a matter of fact. The governor, when she wanted to pass a bill that would have created the roadblocks, we voted it down. There was another one that would have put stricter penalties on people breaking COVID rules. I forgot the exact penalties. We voted that down as well. So I think we have been the checks and balances. And I think it's a misnomer to think that we've just rubber stamped everything the governor sent down. We have not. We've actually sat there and said, no, this is too far. This is not good. Sorry, Gov, we're not going to allow this to go through. So I think we have done our part. Thank you.
Thank you, Senator. Senator Brown, you have 2 minutes to respond to the question or to whatever. Starting now.
Certainly I'm not in the inside of the legislature and have not been for a number of years. So from my perspective of where I'm at, I think the current legislature has failed to be as engaged with the public as they need to be. I've been in many sessions. I've been in sessions till the sun came up the following morning. So I have that experience. And I think this current legislature has not been as engaged. I sense that out in the community when I meet people and they approach me and want to talk about the politics of what's going on. For example, like addressing the business privilege tax and giving some relief to the private sector. I mean, this current legislature could have gone into session any day of the week, any time of the day or night to address some of those really pressing issues. And they've not done that. I mean, yes, the federal government, but that money's drying up and there are limits to how many of our people that could be helped with that. This current legislature, in my estimate, and I can speak from a point of experience, because right now, aside from Robert Underwood, time-wise, I'm the second oldest politician in terms of politics running for office right now. The lack of check and balance by this current legislature and engagement to ensure that services are being provided, even within their oversights. Each of these senators that have oversights right now in the majority could be going out there having oversight hearings to find out, is the government being as efficient as it can? Are we restructuring the government so that we can use the government resources, employees that we have that are from so-called non-essential agencies? Can we move them and assist in facilitating so that they can do things to help or assist the public in a better way while we're going through these challenges? I don't see it and I don't hear it. So I'm not going to say, oh, well, they're doing a great job, because I really think that, and we'll know in a few weeks, everyone, whether or not the people of Guam are satisfied with the current leadership that they see. But that's one of the reasons I'm running after all these years, is because I'm so disappointed with the leadership direction, the lack of check and balance, the lack of transparency and accountability in our government that I believe our people deserve.
Thank you, Senator. Chief, you have 2 minutes to respond to the question starting now.
Thank you, Chris. And I think that's a very good question. I'm going to be very critical about the 35th Guam legislature. And while I never served as a senator in the legislature, I have served as a director, as an executive in the government of Guam. And I see that what's happening here, and I'm going to use a figure of speech, that this would have been the time to shine for the 35th Guam legislature. This is when, at the onset of this issue, they should have been having Zoom meetings, Google Meet meetings, whatever kind of meetings you could have had to figure out how to try and deal with this, to be able to come up with some kind of solution and look at it from a holistic point of view, not just from the government of Guam standpoint, but how is this going to affect the entire government? And as time elapsed, as things went on, we saw how this impacted the government. This impacted the people of Guam. This impacted the private businesses. And again, being critical, I don't think that enough has been done by the 35th Guam legislature to be able to effectuate that and to be able to address some of those issues. That business privilege tax could have been one way to be able to get micro businesses, small businesses, and business in general to want to stay open, so that we don't have 34,000 people plus unemployed or underemployed. And the checks and balances, again, I go back to that transparency question. You know, I question about some of the procurement that's been going on, going to certain peoples in the community instead of going through that process of ensuring that it's done fairly across the board. So again, I think that more could have been done. And I use that proverbial saying that this would have been their opportunity to meet in the virtual space, come up with solutions, come up with a plan, and push that to Adelup and force the issue, because that's what the people of Guam have them there in place. So I think more can be done, and I'm very critical about that, and I look to be very critical should I make it into the legislature. Thank you.
Thank you, Chief. Bree?
Wow, that was a lot. During the pandemic, and Chief, you kind of brought it up, and just remembered the road we went down when this all went down, and it was the governor citing her Emergency Health Powers Act, superpowers, and we saw an oversight hearing where the Attorney General was basically pleading the fifth, because he was representing the governor, and providing advice in terms of how we paid out, or federal funds, I'm not sure what money at this point, was used to pay the quarantine hotels. And there was no contract. There were some agreements, but some of those agreements weren't even signed. And all we heard about was this letter that was written to the Department of Administration to pay it. And yet, we haven't seen anything since that oversight hearing. Do we need to changes with the procurement law? I know Senator Sabina Perez introduced a bill, but what changes do you think are needed with our procurement laws? And we'll start with you, Senator Brown.
Thanks very much for Sabrina for that question. I think a lot of people, that issue raised quite a few eyebrows, because this is, it's the first time we're dealing with a pandemic of this type. This is not the first time we're having to deal with emergency procurement of the government. We've had other natural disasters that the government of Guam, through the Office of Homeland Security and Civil Defense, have had to respond to. And our people, of course, of the things we know well, certainly typhoon recovery, we have that down. But the whole process of how this came to be and it came to light just raised a lot of questions. Why did that need to be done through the governor's office? Why didn't Homeland Security be the one, and their key people that are very well versed on how to deal with emergency response? Why weren't they involved in properly overseeing that? Because had that happened, everyone knows you're going to have to address emergency procurement because of the circumstance, but none, a lot of these questions that make you wonder, was this done properly? Was there special interest involved, especially when you're dealing with this kind of money? And also, yes, of course, the legislature is not in charge, as they say, of overseeing the expenditure of federal funds in this emergency, but more the reason for the administration to provide that information publicly so that there's transparency, so everyone knows, hey, that's how the money's getting spent, and it's getting spent in the right way, rather than this, oh my goodness, they've got millions and millions of dollars, but they're not telling the people of Guam how that money's being spent because they don't have to. I think that's the wrong message to send out there, especially when we're going through trying times. And the worst part is to think that during this pandemic, when people are suffering, when people's freedoms and liberties because of this pandemic are being adversely impacted, when we see this kind of stuff going on, that's the kind of stuff. Where's the Guam legislature again? Where's the check and balance to find out how the procurement was done, and was it being done properly? And was the money that's intended for the people being given to the people in the right way? Had that been done, I don't think we would have ended up with all that controversy. Until this day, I don't have the answers. I bet a lot of our people out there in the community don't have those answers. And that's the type of question.
Thank you, Senator Brown.
That the legislature should be involved in.
Chief.
Thank you, Sabrina. And Sabrina, that's a very good question. And when it comes to procurement, we all know in the government of Guam that there is a procurement process. And even with emergency procurement, regardless of the situation, whatever the emergency is, there's still a process that needs to be followed. And that, Sabrina, I question. That whole issue of the quarantine facilities and how that was being run, how that was being procured, I agree with you. We still don't know. I think, like you had alluded to, maybe there's one letter that got put out. So again, there is a process that's in place. There's a procurement process in place. While I think it needs to be streamlined, I think we need to take a look at that process, even on the emergency procurement piece, but there's still that process, and being able to communicate that to the people of Guam so that we are aware of how this money is being spent, even if it's the federal government's money, regardless. I think that kind of transparency, and we've talked about that time and time again, that needs to be made available. And just saying that, the administration doesn't have to justify that to the people of Guam, I think is wrong. And I think, again, we need to be critical about that, and that we need to follow this process. Whatever the process is, follow that process, and then all is well, and communicate that so that the people of Guam are aware of that. I think that's where the legislature could have stepped in that regard, and stepped in and said, this current administration, how is this money being spent and why? Are we going through those checks and balances, like Senator Brown said? So I think that we need to take a look at that. We need to be critical about that process. And whether it's an emergency procurement or not, there is still a process, And I personally question that. Many people who I've spoken to question that. And I think that those questions still need to be answered by this administration. Thank you.
Senator Rangel.
Yes, so on the question of procurement, Senator Sabina Perez did hold an oversight hearing. I'm not the oversight of procurement, but she did hold an oversight hearing, and she did ask a lot of questions, and there were answers given. If this is specific to things like the quarantine facility, if you're talking about Pacific Star, let's just get straight to the point. If people are concerned about Pacific Star,
It was actually all of them.
Okay, well, GHRA went on the record and said that yes, someone in the administration reached out to them and said, hey, can you talk to your members and see who would like to be a quarantine facility? The answer GHRA got back was crickets. No one wanted to be a quarantine facility, especially at the beginning of the COVID crisis when no one knew what COVID was. No one knew how infectious it was. No one knew how bad it was. So they had a hard time finding any takers. Eventually, they went back out to their members of the GHRA and finally got some takers. And those takers are the ones who eventually were given the procurement for that. Now, if there were mistakes made and how they did, there probably were. I'm not too familiar with the entire process and what happened. And of course, there was a lot of back and forth going on between who said what in an email. Well, that all needs to be fleshed out for sure. And if someone did something wrong, then they should absolutely be held accountable for it. And as was mentioned before, this is federal money, so I'm certain the feds will hold them accountable for it. And I believe the public auditor is going to be auditing all of the federal funds that have come through as well. I believe he's said that before. As a part of the CARES Act, he's going to audit the money and how it was spent, and also put that report out to the people.
Thank you, Senator. It's now time for our 2-minute closing statement, and we'll keep it with the incumbent Senator Clint Rangel. Your 2-minute closing statement starts now.
Thanks. And thank you very much for having me, and you're welcome for being here. Thank you. So first of all, I'd just like to say I'm running for re-election. These are tough times. These are very difficult times. I know a lot of people at home are dissatisfied with the way things are going, and I don't blame you for being dissatisfied because these are difficult times. There's a lot of uncertainty out there, and there's a lot of uncertainty for us too as senators as well. And as leaders, there's tons of uncertainty. We don't know everything about the coronavirus, and we don't know exactly what the future will hold. But what we do know, and what I know, is that I will do my best and work my hardest to come up with solutions, to come up with real solutions, and to figure a way out of this. Now, right now, my priorities are this. First, we have to get COVID under control so that we can get our island healthy again. Then the next step is to work on the economy. And my platform is designed specifically with the economy in mind, specifically diversification of the economy. And that's why agriculture is a big part of my platform. Agriculture is a big part of my platform because I believe it's time we start growing and producing our own food. Imagine if we import 90% of our food. Imagine if we just grew 50% of our own food. Imagine the jobs we would create, the businesses we would create, the revenues we would create, and imagine all that revenue staying on island instead of going off island to companies like Tyson Chicken, who certainly don't need our money anymore. So please vote for me. I will do my best. I will work my hardest. I know that these are challenging times and people aren't satisfied with everything we've done. And we're not perfect. We're trying to figure out how to solve these issues as well. There's a million issues to deal with, but I will do my best. Thank you.
Thank you, Senator. Chief, 2-minute closing statement starts now.
Thank you, Chris, and thank you, Sabrina. Thank you to the people of Guam. Like I had mentioned earlier, thank you for having me as a Republican senatorial candidate. And what I bring to the table, what I bring to the people of Guam as one of their elected leaders, as a senator in the 36th Guam legislature, is over 30 years of experience in the United States military, experience in the government of Guam, experience in law enforcement, executive level experience, leading the Guam Police Department. I bring education to the table as well. And as I look to do that, I do that for one reason: to effectuate positive social change in our community. That's what I'm looking to do. I'm not looking to the downside or take that lower road on this. I'm looking to how can we move our island forward to effectuate that positive social change. Now, my platform is built on 5 things. The first and foremost is our economy. This virus has taken our economy and just shot it down. So we need to get our economy going. We need to get businesses to open back up. We need to get our 34,000 people plus who are unemployed or underemployed back to work so that they can put food on the table, they can pay their bills, and they can continue to thrive and not just exist, because it's not enough to exist on federal government. We need to thrive. Now, once the economy, we get our economy going in that direction where we're on an upward glide path, then of course I'm going to look at what I call the 3 pillars of government: health, safety, and education. And as a former chief of police, obviously I'm looking at what I can do to make things better from a public safety perspective, from a public health perspective, and from a public education perspective. And as a veteran, having served over 22 years in the military, I know what our veterans are dealing with, and I see it myself. And I want to be able to help out our veterans to be able to
Thank you,
effectuate
Chief.
change
Thank
for
you,
them in
Chief.
a positive direction
Thank you,
as
Chief.
well.
All right.
I asked for your
Chief, thank you, Chief. Okay. Last 2 minutes. Former Senator Brown, you have 2 minutes to issue your closing statement starting now.
Thank you very much, Chris, and thank you, KUAM, and all of you there for giving us the opportunity to be able to engage in the public and have them get an idea of what it is that's important to us and why we're running, and hopefully why we would like them to give us the opportunity to serve again. You know, I've been in government for many years, and I definitely have the experience walking in. And there's a specific reason why I'm running. I want to see accountability back in our government. I want to see our government be free of corruption that I so flagrantly see happening these days. That's why I'm running again. I don't think you can build on this government and address the issues of healthcare, education, building our roads and our schools that we need and that our people want out there unless you address the foundation of corruption that does exist in our government. I mean, I've already been attacked. I've been slandered. I've had truths made about me and my career and my public service to the people. But I'll tell you, I've always been a fighter. I will continue to be a fighter, and I will continue to fight these issues because it's the right thing to do. If the people of Guam are dissatisfied with, as I see it, with the current leadership that exists in this government now, and they want to change and they want a better direction, by all means, please give me your vote. I'm number 2 on the Republican side of the ballot. And I'm also going to ask, because you know what? One person can't do it by themselves. If you really want to see a change and you're dissatisfied with the current Democratic leadership in the Guam legislature and what you're seeing in the administration, then by all means, please vote on the Republican side of the ballot and help my fellow colleagues and candidates that are running. Because if you want to see that change, you're going to see that change if you put us back in. And if we're fortunate enough, we'll continue to do what we need to do to serve our people. So again, thank you very much for this opportunity. It's been good to talk to you, and certainly also to hear from our fellow candidates that are also running this morning. So thank you, and I hope everyone has a good and safe weekend.
Thank you, Senator. Thank you, Senator Rigel. No time limit on saying goodbye. Let's go.
Goodbye?
Yeah, we said bye. That's it, yeah.
I appreciate your time this morning. Thank you for having me.
You're welcome.
Thanks for having me as well.
You're welcome,
Thank
too.
you.
Have a safe weekend.
Thank you. Thank you
You
very
too.
much.
Bye-bye.
Dankulu na si Zeus maasi Chris and Sabrina. That told me for million KOAM. Si Zeus maasi. Thank you so much for this opportunity. Thank you. God bless you all. Thank you.
Okay, there you go. Get the point. They're thankful. They're thankful for this, guys.
Hey, I'm thankful too because I
Yeah.
want to hear from them, and I think people out there want to hear from them too.
Let me just tell you,
This election's been hard.
These are some big guns out here. This, Senator Rigel, Chief J.I., Joanne, they definitely want it, and it's good. We had a comment in here about passion. I can't find it, but basically, passion drives speaking to the issues. Appreciate all the contributions. Here, that comment from D. Marie Solis Flores. Couldn't agree more. I mean, it's definitely good to get these guys. I don't, Democrat, Republican, however you may feel about their stances, they articulated their points very well.
Great job.
Good job today, Sabrina.
Good job, Christopher.
Okay, we
Good
got
job,
your
Jason.
Yes, I
Good
got
job,
Joe
Joe,
Sir, Engineer, Master Control. Takeaways this morning, Bree.
I was surprised that the ISOFAC is finally opening. They're bringing 4 COVID patients from GMH over to the skilled nursing facility in Barragata. We heard that they hadn't been able to open it because of the chiller, and then they didn't have staff, and they still really don't have staff. But GMH is, as Lillian Posada said, is bursting at the seams. And it's gonna get worse.
Yeah.
Because the numbers have not dropped. And 66, I want to say, was it 66 last night? Every time there's a number, it's like 10 to 20% will end up at the Guam Memorial Hospital.
Right. And we're seeing that now. And the bottom line from Dr. Hoa Wen, well, at least what he's been consistently saying all week is we're not moving backwards. So those people out there who are thinking that, all these people are dying, there's so many positives, we got to close something down. They're not going to close anything down.
Yeah. What all he's saying is that for at least for 2 weeks, stay home, but stay within your family, your household. Don't go to your grandma's house next door, your auntie's house next door. Just do it for 2 weeks.
He also said that what it would take to get these numbers down and to get everything down would be a crazy martial law style lockdown, but they're not going to do that.
No.
So it's interesting. We got your 6 with our KUM News primetime broadcast again. Thank you guys. Thank you. Undonkalu nasiduo sa Aussie for your support here on this show. The link, it's brought to you by Carrier, 647 Cool, Calvo Enterprises, IT&E, and the Thrive Coalition, where it takes a village to raise healthy and drug-free youth. My name is Chris.
I'm Sabrina. You know what to do, so please just do it. We don't need to keep telling you.
Actually, we do. I'm going to tell you guys.
I don't think so. I
Stay
think
home.
everybody knows.
Yeah, well, I don't mind saying it a lot.
Okay, go
Wash
ahead.
your hands,
Yeah.
stay home, social distance, wear your mask. People, mask it up. Okay, 10:15 again.
Bye.
Bye.
Catch the link on Breeze 93.9 FM every weekday morning.